So we did it. We've arrived at week 14. Yay. So this is our last lecture, ladies. And I'll tell you what, I'm recording it Saturday right now, and it's Saturday evening, and it's snowing outside. Right. I know. Mid-April. Is this not insane? And I know you're in Iowa, so you definitely know. Oh, well, you know what, though? We're going to talk about some very interesting organisms, infectious disease causing organisms, including parasites. Hey, and speaking of parasites, here is my music pick for the week. The song is entitled My Tapeworm. It is by Jennifer Teeter, and she plays the ukulele. There's a wonderful little YouTube link there. You can just type in Jennifer Teeter and My Tapeworm. She does a live performance. It's very amusing. I think you will enjoy it. I hope you will. Take time to laugh. All right. So objectives for this week. My goodness, it looks like, wow, there's hardly anything there. Well, unfortunately, these are very broad. Compare and contrast major infectious agents of the neurological system, and then also we're going to look at the GI system and the urogenital tract, and that includes the sexually transmitted infectious diseases. So this is going to be a really good lecture, right? All right. As far as the assignment, the last assignment, this one's a little unusual, not very unusual, just a little bit. It's entitled Sculptors of Monumental Narrative. And this is actually from Radiolab. And I don't know if you listen to NPR. Radiolab is so interesting. If you have an opportunity to listen to it, they have the podcast, even if you can't get it live. But I ran across this and I love it because it includes two stories about hookworms. Yeah. And the first story is from Dr. Dixon DePalmier, and he is from Columbia University, and I love this guy. One of my other podcasts is This Week in Parasitology, and he is one of the main hosts of This Week in Parasitology. So if you need something to listen to over summer break, hey, there you go. So he has a story about hookworms, and also, and by the way, they do mispronounce his name. It is DePalmier, but it's okay. And then there's another story from a Jasper Lawrence. Both are very interesting. So make sure that you read the instructions. You're going to summarize for the most interesting aspects of this podcast, two from each story. And then I want you to spend a little time on the last story because it also brings in the hygiene hypothesis and talks about the immune system, how it gets a little confused. Okay, we've talked about this. So I want you to spend a little time on the last story on Jasper Lawrence's solution as it relates to the hygiene hypothesis. Okay, should be fun. Okay, it should be interesting. And you should know, by the way, this is all audio. There's no video. So you're just going to link on to this and you're just going to listen. It's interesting, a little freakish, though. Enjoy. Oh, and there's the rubric. Okay. Oh, before we forget, next week is very, very short. And the only thing you have to do for me is get the research paper in. All right. Look online. Make sure that you run your research paper through the test Dropbox. I have a little note to do that first. Check it for originality. All right. If you have any questions, if you want me just to look something over, send it my way. I would be happy to do so. Okay. So that is due Wednesday by April 25th. What that means really is that our class is done Wednesday, April 25th at 11:59 p.m. Yay. There's our terminology. All right. So once again, I just wanted to mention that these categories will overlap. They have to overlap. There's no getting out of this, especially when I talk about Staphylococcus aureus and staph diseases. So And I also wanted to mention that it's so hard to choose the best representatives for this course. I do the best by including some of the most medically significant pathogens that you might encounter, but one of the things you have developed now is the skill to do a little bit of research on your own. So anything that I didn't cover or anything that you forget, well, golly, you can just get on the internet and you can find some good resources and do the research on your own. And by the way, you can always email me if you have any questions or if anything comes up later on, outside, just years later. I have students that are always emailing me or calling me. That's fine too. All right, so we're going to begin with neurological diseases now. Okay, so when it comes to neurological diseases, this is going to impact the central nervous system, CNS, and the peripheral nervous system, the PNS. So the central nervous system would be like the brains, spinal cord, and then you've got all these peripheral nerves off on the side. And because the nervous system impacts a lot of tissue, well, by golly, neurological diseases will impact other tissue. So, what's going to cause neurological diseases in microbiology? Well, pretty much everything: viruses, bacteria, and parasites, all of which we will cover today. Really, disease is all going to be about inflammation, almost always. Now, there are some toxins that will stop nerve impulses. Clearly, that's going to be a problem. But if you have an invasion of bacteria or viruses or parasite, you're going to get inflammation. And when all of those immunological cells rush to that area, well, it's going to swell. You're going to get pain, okay, because you've got nerve endings, right, that will tell you, ouch. You're going to have pain. And the swelling can cut off the blood supply to the tissue. Now, that could be really bad when we're talking about the brain and the spinal cord, don't you think? Yes, indeed. So also know because of inflammation, you can have mechanical damage. An active infection, right, is going to be, you're going to get inflammation, you're going to have a battle zone, and there's always collateral damage as a result of inflammation. The symptoms will be very broad. Okay. And it can range anywhere from asymptomatic, meaning you didn't get a symptom, or severe symptoms, paralysis, or even death. All right, we're going to begin with something that's very topical. When it comes to neurological diseases, the Zika virus is in the news quite a lot. And so when it comes to the Zika virus, it is a virus. It is an enveloped virus, in fact, but it is spread by mosquitoes. Okay. So it's not going to be in the air. It's not going to be in fecal matter, probably. We haven't found it there yet, but it's easily transmitted by viruses, so it gets injected. It infects the epidermal keratinocytes. I did it. For some reason, I was falling over that. I don't know. So the outer dermal layers, right? It also gets into the immune cells of the skin, including the skin fibroblasts and dendritic cells. Remember those guys? The antigen-presenting cells, the ones that eat up the invaders and then present them to the T cells. Yeah, Zika virus will get into those. The really tragic part about the Zika virus is that it does cross the placenta and get to fetal brain cells. They're still working on all of that information. So, like I said, transmission is through a mosquito vector. Vector is anything that just carries infectious disease-causing agents. Okay? So a mosquito carries the virus, and then the mosquito, when it takes a blood meal, injects the virus. And we're going to talk about this again. Sexually, there were some reports in the news that this could be transmitted sexually. Not all the evidence is in yet, but it does seem plausible because, well, it is found in the urine for sure. So when it comes to sexual intercourse, it seems reasonable that that could be a way to transmit the virus. Symptoms. Well, in an adult, you get a fever, maybe a rash, maybe joint pain. The problem is if you are pregnant and it does cross again through the placenta and can cause birth defects such as microcephaly And here you see this is a baby with a typical head size. This is from the CDC. And here's a baby with microcephaly. Clearly, this is quite tragic. On the right-hand side, you can see a map, and this is where we see this, we say it's endemic in these particular areas, so at the very south part of North America. So, yes, more or less in Mexico, Central America, and South America. Why just here, you ask? Because that's where we find this mosquito. A lot of infectious disease causing organisms that are spread by certain vectors. They choose one vector and that's kind of it. So when you see the vector, you can see the disease. And this is where we see the mosquito that carries this virus, and that's why we see this here. So prevention, avoid or block mosquitoes. You know, if you're visiting these countries and you are pregnant or about to get pregnant, well, maybe just stay in the car or stay in buildings. If you live in these areas, well, a lot of times you have the windows open, so it's a little more difficult. There are pesticides that you can use, pesticides with DEET, which I will talk about a little bit later on. You can use mosquito nets, excuse me, to block mosquitoes. I have a website here from the CDC. You can click on this if you want to know more and get some CDC statistics on the Zika virus. They are there. So Zika is not the only virus that infects the central nervous system. So there are a lot of viruses, and a lot of them are spread by mosquitoes that, well, it will infect the brain. So when the brain is infected and becomes inflamed, that's called encephalitis. And there are a lot of viral encephalitis diseases. Okay, we're still in the neurological diseases. So encephalitis is defined as an infection, disease, and swelling of the brain. Over on the right-hand side, and I didn't mean for all these to come up, but over on the right-hand side, you can see, okay, so we've got the skull here, and here you can see the brain. So when this becomes inflamed, this is encephalitis. The symptoms of viral encephalitis, well, it ranges once again. Some people never get a symptom, but if they do, it might be flu-like. And that would include high fever, headache, chills, malaise, joint and muscle pain. A friend of mine had West Nile, which is viral encephalitis. It's a different kind of virus. The West Nile virus is kind of different than what I'm going to really stress, but he was very feverish. It's like, Sharon, could you please get me a Frosty? So it's very flu-like, and not by that I do mean influenza. He was in misery, poor guy. So, by the way, he was in Africa, but that's not where he got it. He got it in Kansas during a tractor pull. Mosquito bit him, and he got West Nile. And it didn't develop into encephalitis, but it can. When it does develop into encephalitis, that is what we call severe, and it can cause seizures, confusion, and a loss of consciousness. Well, again, if this swells, where's it going to go? So it can cut off your blood supply. Okay? You could imagine. And once again, when it comes to viral encephalitis, the biggest culprit would be mosquitoes. Mosquitoes are very well-known vectors or transmitters of encephalitis causing viruses. And again, viruses, what are they? Are vectors, what are they? They are something that carries pathogens, okay? Vectors are carriers of pathogens, and this is, she has a nice manicure. All right, so when it comes to viral encephalitis viruses, what's a good example? Well, the equine encephalitis viruses are very common. Now, Miss Eden, you ask, I thought we're talking about human health. Why are we talking about horses? It turns out that horses are reservoirs of viral encephalitis, meaning that the virus can be in the horse, and then a mosquito bites the horse and then comes around and bites a human. So the mosquito carries the virus from the horse to the human. To be honest, this is more common in birds, even though it's called equine encephalitis, and the birds are major reservoirs. Truly, we sometimes call the humans and the horses the dead end hosts. The birds are normal carriers and reservoirs. So, all right. So there's lots of equine encephalitis viruses, and they always end in eve. So there's Eastern equine encephalitis, and where do we see this? In the eastern United States for the most part. This is quite serious. I'm going to talk about this one. The mortality rate is 33.3%. So this is quite serious. But remember, this is inflammation of the brain. There's also VEVE, and this is Venezuelan equine encephalitis virus. There's Western equine encephalitis virus, or WEVE. Got it? All are, again, viruses that are spread by mosquitoes, and they can impact horses as well as humans. I already mentioned West Nile. This is different than the equine encephalitis viruses, but once again, West Nile is transmitted by mosquitoes. Yellow fever also transmitted by mosquitoes, all of which will cause viral encephalitis. I know this is horrible. I debated whether to show this. I wanted to show how this can impact the horse. So just know this is serious, not only for horses, but in the humans as well. Doesn't bother the birds as much, okay, if at all. So what do we do? I mean, this is awful. What do we do? Well, the management is primarily on supportive and preventative measures. We really don't have any antivirals for this, okay? So very serious, very serious. Okay, no effective antivirals. So maybe we could go with prevention. Okay, let's stop mosquitoes. One of the things you could do is drain standing water. You know how they tell you to do that? Well, this is the breeding ground for mosquito larvae. So you drain these things, okay? Get rid of them. Another method is prevention. I mean, we can use a bug repellent with DEET. Just a little. Now, DEET stands for diethylmetatoluamide, and DEET is much better to say, easier to say. I was looking at Consumer Reports. You don't need to know this, but they found that when it comes to repelling mosquitoes and ticks, that the 15 to 30% concentration of DEET is the most effective, and they suggested don't go to natural plant oils. It's kind of nice, but remember, when we're talking about encephalitis, do we want to mess around? And these are just a few of the diseases spread by mosquitoes. DEET is also effective in repelling ticks, okay, that also are vectors of many diseases, okay? Now, again, when it comes to vectors, where you find the vector, that's where you're going to find the disease. Little side note, as we have climate change, certain areas are going to experience some warming. I know we used to say global warming, but that was a misnomer. Certain areas would get cooler, some would get warmer, and the areas that are going to get warmer, well, there might be a problem. One of the reasons we don't see a lot of these infectious diseases is that the mosquitoes and the other vectors don't get this far north. Why? Because we have the good summer or winter freezes. Sorry, the winter freezes will kill the mosquitoes. They never get this far. However, if it warms, will the mosquitoes come up north? Well, we have seen this with tree diseases, so it's very likely. This, by the way, when it comes to encephalitis, this is Eastern equine encephalitis. This is where we normally see them. And around the Great Lakes, you have, well, it's a little kind of strange there. But for the most part, a lot of diseases, you know, the mosquito-borne diseases are limited by very hard frosts, okay, in the winter. Okay, now let's look at some more neurological diseases also caused by viruses. Now we're going to go into the herpes viruses. This is very tragic. This is herpes zoster. Herpes zoster, have we heard of this one? Herpes, this is varicella zoster. Varicella zoster causes chickenpox/shingles. So we are going to address why we like the vaccine and we don't like the natural method. Okay, this is clearly severe. This woman could uh, lose her eyesight as well as more. Okay, so herpes viruses. This is a big category of viruses. They are very versatile. Why am I putting them in this category? Many of these love your neurons. They love to invade your neurons and hide out in the ganglion nuclei. So they get into the nerve cell and they hide in the nucleus of your cell, of your nerve cell. A lot of herpes love to do this, not all of them. I'm going to stress the ones that do have neurological ties, okay? All right. So the one nice thing is all herpes viruses have the same morphology. They are all enveloped viruses. So this is good if they're on a counter or on an inanimate object. You can use just basic detergents and disinfectants and it will work. The cells that get infected, well, in addition to nerve cells, herpes viruses love to get into white blood cells and they will get into others. Transmission, well, let me tell you, these are very common viruses. A lot of them can be transmitted just by contact, skin to skin, sexually, and through the respiratory tract. Okay. Symptoms, it just depends. It depends on which herpes virus we're looking at. It ranges from skin lesions to fevers to neuropathy, meaning again, diseases of the nervous system, like numbness, paralysis, or permanent pain. It can even get up into the brain and cause viral encephalitis. And some herpes viruses are linked to cancers. Yes, they are. Okay, so let's talk about herpes viruses in general, the life cycle. Really, when I have a picture like this is looking at the spinal cord, which is part of the central nervous system. And here we have a dorsal root, and you have a sensory neuron here, and here's the nucleus. And then it tracks out to the dermis out here. When this illustration really is looking at the first few herpes viruses, the first four, not so much the rest of them, but I just wanted to generalize, and we are stressing neurological diseases here, okay? So when it comes to the life cycle, you can have an acute infection where you get hit, you have symptoms, or maybe not, and then it goes away. But like I said, herpes viruses will hide. Where? Right here. A lot of them will hide right there. And when they hide, remember that's called a latent infection. Remember we learned that term latent when it comes to viruses. They hide. Okay. And because all of these are DNA viruses, like I said, the viral DNA hides in the cell nucleus, like right here. The latent disease then is stimulated, meaning that it comes out of it and it's no longer hidden, it's no longer quiet. The viruses start to replicate and then they come out. And what normally stimulates that? Well, lots of things. Fever. Heard of fever blisters? Okay, out here on the dermis, you get little blisters out there. Yep, fever blisters. Okay, abrasion. So little bit of a ow or a cut or a wound or surgery, like a surgical wound, something like that. UV light. Sometimes people will go skiing. They get up in Colorado and there's a lot of UV light and they get a little herpes outbreak as a result. Stress is a biggie. This is the one students do tend to remember, which is good because you are going to see a lot of very stressed out patients. Okay, maybe stressed out students as well. And they're going to have fever blisters, herpes, cold sores, herpes, and shingles. Herpes. Yeah. Stress. Disease and stress. Okay, it's going to trigger the latent form. If not, I mean, if it's not triggered, it can lay dormant for a very long time. All right. Now, first I'm going to talk about herpes simplex virus 1 and herpes simplex virus 2, HSV1, HSV2. Back in the old days, we used to say HSV1 is above the waist. HSV2 is below the waist. But I'll tell you what, both viruses now, they are different, even though they're cousins. They're both herpes, and they do different things. And the pathology and how they cause disease is different. But both of them will get in through mucosal membranes, and you have mucosal membranes here. You have them here. And it is possible then for HSV1 viruses to end up down here and HSV2 viruses to end up here. Use your imagination. Think about it. I won't go there. All right. So the HSV virus 1 loves the trigeminal ganglia. If you remember this from your anatomy, hopefully you do. HSV2 is going to love the lumbosacral dorsal ganglia. So back here, literally the back, right? Okay, so let's talk about some of these. So herpes simplex virus 1, HSV1, we used to say this is above the waist. The common street term for this is a cold sore, but it is a herpes virus, yes? Okay, transmission, anything that's mucosal. So yeah, through sexual contact, a kiss, and possibly, other means it's probably possible. Symptoms, you get mucosal eruptions. So on the lips, they are called fever blisters or cold sores, but you can get these on the genitals as well, but it's kind of different than the other herpes I'm going to talk about. So let's say you kiss someone with an active lesion and it enters and it gets in and hides, and then every time you get stressed out or something, it pops back out on the end of a nerve ending and it's going to hurt. Okay? Got that? Some of you know this firsthand. I do. Okay, like I said, so latency is what happens after the initial acute, infection, when it hides. So when this gets triggered, viral DNA is produced, and this is all going to happen inside the trigeminal nerve cell, and everything tracks back out. Here you can really see, here's the trigeminal nerve, and if you remember this, look at everywhere this thing goes. So this can cause some very severe problems. And here we have that poor lady once again, and you can see how it tracks along the trigeminal nerve. Here we are once again. So, and herpes viruses can cause encephalitis, just so you know. Okay. How about the second one, herpes simplex virus 2? We used to say this one's below the waist. So this would be down in the lumbosacral region, okay? And again, same thing happens. You get an acute infection. The herpes virus, the HSV2 virus, hides inside the nucleus of the sensory neuron, okay? Transmission, again, typically sexually, but sometimes babies, while traveling down through the birth canal, can pick this up from mom, unfortunately. Again, you get mucosal to mucosal contact. This will transmit it pretty effectively. Symptoms include, well, okay, again, you get genital eruptions, and again, primarily due to sexual contact. Latency, once again, usually follows the viral DNA hiding inside the nerve cell nuclei. So it hides, it's latent, and then the DNA from the virus hides there, and then it pops back out again. In the old days, by the way, we used to say that, well, it's okay to have sex when you no longer see the lesions. Now, this used to just make me wonder, because I'm a cell biologist and I wasn't even a very good cell biologist way back when, because I was still a student, I was learning, but I thought, cells are microscopic. How do you know the cell or cells are not releasing viruses? How do you know? And especially in women, I mean, the eruptions would be they would be rather internal and hard to see. Turns out, in fact, with herpes simplex virus 2, yes, the viruses are shed, the particles are shed 75% of the time, even when you do not see any signs, even when the lesions look absent. Okay? Again, this is especially, the herpes simplex virus 2 is especially bad for neonates. Neonatal infections are common and may be fatal. It can cause neurological defects. Why? Remember what I said, herpes viruses, most of them love neurons. You don't want a herpes virus infecting your fetus, your newborn. Of course, this is bad. This can even cause spontaneous abortion. One other thing, it is associated with HIV. What? Yeah, okay. So, and it's actually associated with other sexually transmitted infectious diseases. Do you remember what I said in the immunology defense lectures? Your first line of defense is your skin. When you have these little eruptions, you have holes in your skin. So these are open doors. Now, not only can infectious agents get in here, but when it comes to HIV only likes certain white blood cells, right? CD4 cells. Well, if you have an opening, then you're going to have an inflammatory response because your second line and third lines of defense, they don't like openings. This is damage. So what are you going to do? You're going to send in your white blood cells, including your CD4 cells. So not only is the herpes virus going to open the door, but the inflammatory response will send a limousine to come and pick up HIV viruses. Okay? All right, so let's talk about the third herpes virus. This one is known as the varicella zoster virus, or VZV. Back in the day, like when I was very, very, very young. Now, scientists thought that chickenpox was due to something called the varicella virus. And there was another condition that sort of looked like it, but wasn't, and it was called shingles. And they said, well, that's caused by the zoster virus. Eventually, virologists got their act together and said, you know what? These are both the same herpes viruses. And it's just that varicella, okay, what we used to think was chickenpox was the acute or primary infection. And if the virus hid inside the neurons and came back out again, well, then you have shingles. So varicella zoster was put together, and now we call this one virus the varicella zoster virus. But some people will still call shingles the zoster, okay, and the vaccine zoster. Well, how is transmission? Okay, that was too dramatic. My apologies. Respiratory droplets, and it is extremely contagious. So if you and I were in the same room together, actually, you probably would have left. I would probably, if I was infectious, you'd have about an 85 to 90% chance of getting chickenpox from me. Very, very contagious. If we were in the classroom, same odds. Okay, very contagious. Okay, now what happens? So let's say I sneeze or cough in your direction and you take it in through the respiratory tract. Well, now we're going to start with the two syndromes. Now, chickenpox is the initial syndrome, and that means the viruses get in through the respiratory tract, and they're going to travel around in the lymphocytes, like white blood cells. Yeah. And they can travel all over the place. And where do they go? Well, they get into my respiratory cells so I can transmit it a little bit, or well, excuse me, they can get into your respiratory cells. So you can transmit it a little bit, but it will also get into your skin dermal cells as well. Okay? And you see, you'll get these eruptions all over the place. And chickenpox, being the initial infection, again, you just see diffuse, disseminated vesicles all over the place, lesions. Okay, all right. Now, if you get a really bad infection, chances are the viruses then, as they're going to be replicating in these dermal areas, but they'll probably get inside a neuron. All right. If they are not stopped by antibodies or by the cell-mediated immune response, then they're going to get up and hide inside the neuron and become latent. So here we are again. We are here in the ganglia. Okay. And if it gets triggered, it tracks back out. And we call this condition shingles. So this is when the latent or hidden virus is reactivated. Okay. So what the interesting thing about this is that it only occurs unilaterally. So whereas chicken pox, the primary infection is all over the place. When it comes to shingles, you get it on one side. Okay, because it tracks usually on one particular group of nerves or nerve. Very painful when it comes out on the nerve endings. So be nice to people who have this. Here you can really see it tracking through the neurons. Okay, and it forms again lesions, but only on one side. And because it's coming out of nerve endings, it's gonna hurt. Oh, I should let you know that sometimes if this is really bad, the neuropathy is permanent. There are people who get shingles, especially the elderly. They can get such a severe case of it that they have permanent neurological damage, and it doesn't go away. The virus goes away and the shingles goes away, but the neuropathy stays. In some cases, severe cases, even a shower that should be comforting and kind of relaxing can be excruciating. Wearing just normal clothing can be excruciating. Just sitting and lying down can be excruciating. So this is very bad. We would really not want this to happen. Okay? But this is what happens when you have a very virulent virus. And that's what varicella zoster virus is. So, why get a vaccine when you can do it the natural way? You had a little weekly assignment last week, right? And there's a bit of a discussion about this. So, here's a young girl, and she's going to get her chickenpox vaccine, her varicella zoster vaccine. So remember, this is an attenuated virus, and it would be nice that, she's going to make memory cells. And okay, if it's attenuated, it's probably not going to get too far. Um, so hopefully. Now, here's the old method. We just let children have natural chickenpox. We send them to chickenpox parties, and hopefully they sneeze and cough all over the place and give it to other children so they will have immunity before they reach adulthood. Here's the reason. There's some very serious complications associated with chickenpox, varicella zoster virus. So one thing that can happen is these things are very itchy. I had chickenpox and measles both at the same time and at Christmas. I know of you guys, it wasn't the worst case scenario. At least I didn't get it 3 times, but it was pretty devastating for a young kid on Christmas. And if you've had the natural infection, you know these things are very itchy. And your parents, when the minute they look away, you're going to scratch because no one's, you itch. You do not care what your parents tell you. Well, but you can get a secondary infection, a little bacterial infection. You scratch the wound, the little lesion, and you can inject all kinds of bacteria in there, including staph. Um, the viruses themselves can get into the lungs and cause pneumonia. They can cause bleeding problems. They can cause sepsis. And here's a very nasty picture, and sorry about this. This is from the Department of Pediatrics and Adolescent Medicine, and they said that this can be used as long as you're really good at citing it. So there you go. And here's some other things. Encephalitis. Do you remember when I said herpes viruses? They like neurons, and therefore that means that it can get into the brain. By golly, it can. And not only of young children, but also adults and a developing fetus. This is actually a fetal brain, clearly a biopsy. Okay, so this is a neonatal autopsy. The one antiviral that they sometimes use for herpes viruses, acyclovir, was ineffective. It doesn't always work anyway. So this is when we want the pregnant woman and the children to have herd immunity. Okay, if there's herd immunity, then the virus doesn't get transmitted. Okay, there are some people who just do not seroconvert, meaning the first time they're exposed to chickenpox, either naturally or through a vaccine, they do not make memory cells, and that makes them very vulnerable. And when those adults grow up, and if they get pregnant, if it's a woman and she gets pregnant, this is not good. So it would be wonderful if that woman is surrounded by people who are protected through a vaccine, maybe. And so they cannot spread varicella zoster virus, chickenpox viruses to her and to her infant. Okay. So again, for women, by the way, there is an increased risk in these pregnant women for developing pneumonia, and it can be actually lethal for the mom. For the fetus, again, and it depends on the timing, it can cause potential birth defects. It's not a common thing, but it can happen. If there is some kind of fetus involved, if it does involve the fetus and affect the fetus, almost across the board, low birth weight is almost always seen. Sometimes preterm births will occur. Limb hypoplasia will occur in 46 to 72% of complications in a pregnancy due to varicella zoster virus. And I'm sorry, I hope ladies you're not pregnant. It can cause neurological abnormality, because I know it's tragic to see this. Neurological abnormalities occur in 48 to 62% of complicated pregnancies complicated due to varicella zoster virus. So what can this cause? Remember this? And I know it's important to be concerned about Zika viruses, but we also need to be aware that there are other viruses that can cause some very terrible diseases to a developing fetus, including microcephaly. Okay. This can also, because of this, can cause dementia. If the child is born, it can cause hydrocephaly, water, the brain, right? And mental retardation as a result. So, yeah, do you have some information to give to your patients that, the ones that don't want their children to get the chickenpox vaccine? Okay. So, everybody pretty much agrees that it's better to have either the vaccine or chickenpox at a young age. Why is that? Well, because as you get older, there are more complications. And complications, again, they just tend to be more severe in adults. Why is that? Well, here's an elderly man hospitalized with chickenpox. And the reason for this is almost all evidence says that it's because as you get older, you have a stronger inflammatory response, right? So you get the chickenpox varicella zoster virus. It travels throughout the lymphatic system, gets into the lungs, gets into the dermis, and you're going to get, and I should have had the bomber coming in, boom, 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 boom. You're going to get a very strong cell-mediated immune response. Those are your T cells, right? Cytotoxic T cells and natural killer cells as well. So you can die from inflammation, right? Remember what happened in the Spanish flu? So as you get older, you're going to have a stronger inflammatory response, and chickenpox can really produce inflammation systemically. And so you can have systemic inflammation and it can kill you or cause other severe complications. Like I said, permanent neuropathy. So, okay. So just a reminder, when we're talking about cell-mediated immune responses that are very strong in an adult, those are your T cells, like your cytotoxic T cells especially, and natural killer cells. All right. Now keep in mind, this vaccine is attenuated, so it's given with respect. Could you possibly have a few lesions once you get vaccinated? Yes, but there are only a few. They're only going to be a small little cluster. But hopefully it'll be very quick and very mild. But let me ask you this. Who do you think is going to probably get a bad case of shingles later on in life? Is it possible with this young girl getting her vaccine? Oh, sure. I will tell you one thing. When I first started to teach virology and immunology, I used, and I wasn't alone. The information that I had would say, well, you can't get chickenpox from somebody with shingles. Yeah, you can. Oh, you have to get chickenpox before you get shingles. Not necessarily. Shingles will never do this. Chickenpox will never do that. No. Let me tell you, when it comes to herpes viruses, lots of things are possible. Never say never. But so we have to look statistically in public health terms. And without a doubt, she's going to have a better chance of not suffering from at least severe complications of shingles later on in life or getting chickenpox later on in life, of course. This little one, like me, okay, I had measles and chickenpox. Let me tell you, I am at risk of getting shingles in a severe case. Now, I'm not exactly of the age to get the shingles vaccine and get it paid, but I keep promising myself every year I'm going to go in and get the shingles vaccine. But when I think of it, I'm a little on the stress side. It's usually the end of a semester and when I'm giving this lecture. And it's not good to get an attenuated vaccine when you're stressed. Let's just say it's better to be not stressed. Okay. So believe me, I'm going to get a shingles vaccine. One nice thing, by the way, okay, well, one thing, people my age were used to little kids that are wonderful little incubators and grandkids sneezing and coughing chickenpox on us. And if they're giving us chickenpox by sneezing on us, we make more memory cells, we get natural boosters. With all the little kids getting their vaccines, that's why we need a shingles booster because we don't have as many of these little guys. Okay? There's nobody sneezing viruses at us adults, so we don't get natural boosters to kind of reboost our memory B cells and T cells. Okay, now I'm going to talk about other herpes viruses that aren't typically considered neurological, but yeah, they kind of can get there. But the first one is called the Epstein-Barr virus, and this is the one that causes mono. Okay, the kissing disease. Yay. All right, so transmission is primarily through respiratory droplets, not as contagious as chickenpox at all. And again, the syndrome is infectious mononucleosis or mono, or the kissing disease. So these guys, again, tend to infect the lymphocytes, T lymphocytes especially. You tend to see an increase in mononuclear cells in the blood, in the plasma, or not the plasma, excuse me, in the blood, and that's why it's called mono. Causes a sore throat, fever, swollen lymph glands, very common in teens. Again, they call it the kissing disease. Now, typically we just let it run its course, it's self-limiting, and now it can cause complications in people who are immunosuppressed. Okay. But if you're pretty much okay, it's going to go away. You're going to feel exhausted. Rarely is it fatal. When it is, it's typically because of splenomegaly, an enlarged spleen. Sorry, this image was supposed to come up faster, but I don't know if you can see how enlarged this area, the spleen is. So if you're in an accident, say an automobile accident, or you fall down the stairs, this could rupture, and that is quite lethal. So most patients, though, are allowed to return to work within 3 to 4 weeks, but they're not going to want to. So sometimes they say that this is linked to chronic fatigue syndrome. The walking pneumonia people think, no, 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 this is because of mycoplasma pneumonia and walking pneumonia. The information still isn't in then, but you know what? This could cause some chronic fatigue. Who knows? There's some evidence. Okay, so how about another one? This is the cytomegalovirus. Transmission through mucus transmission, very common. Most people are asymptomatic, though. We very much hope that young girls get it at a young age. And again, typically we do not see any symptoms. And that's good. Hopefully you have memory cells before you have a baby because the complications occur when in a pregnancy. It can affect the fetus and newborn, causing an enlarged liver and spleen and neurological damage. So again, it's not especially neurological, but all of these can do this, okay? Can get into the neurons. Because it's neurological, it can affect hearing and cause hearing loss, visual impairment, and it is possibly fatal. Here we have cytopathic effects of some cells that have been infected with the cytomegalovirus. You know how the cells fuse and you get all those weird characteristics. So this is CMV. Yeah. Okay. There's also a herpes virus called the T lymphotropic virus. This one is called this because it loves to replicate in T lymphocytes. Okay, as well as macrophages, salivary and other gland cells. Very commonly linked to fevers in infants with a rash. So the fevers, again, when you see a high fever and a rash, a lot of times you might think virus. But it also tends to be linked to multiple sclerosis, Hodgkin's lymphoma, some T cell lymphomas, and carcinomas. So cancers, MS, cancer, and if you're lucky, though, just a rash. But even that, you want to be careful. This is just FYI, but I thought you need to be aware. Okay. How is this transmitted? It's respiratory droplets. Okay. Same thing with human herpes virus 7, also through respiratory droplets. I can say that. Achoo, achoo, cough, cough, cough. This one hasn't been as classified as the other herpes viruses, but they know that it can cause hypersensitivity and a few others, possible carcinomas. The last one, though, is not FYI, just because we're numbering these 6, 7, and then the 8th one I didn't want to skip over, because if I went to human herpes virus 8, you'd say, what happened to 6 and 7? But you're not responsible for 6 and 7. But you are responsible for human herpes virus 8. This one is the one that causes Kaposi's sarcoma, so cancer of the skin. So you're thinking, no, I thought that was in people with AIDS. Yeah, you may have been in contact with this virus through respiratory droplets, and nothing happened to you, but somebody who's immunosuppressed will get this herpes virus and get skin cancer, Kaposi's sarcoma. Okay. And also, it's linked to multiple myeloma or a bone cancer. In this particular case, it's the B cell line that keeps dividing, but it's the exact same B cells, and they make the same antibodies. And so this is bone cancer, quite lethal. This is what my mom died of. So my mom was, when you're diagnosed with bone cancer or any cancer, it's scary as can be. She was trying to figure out what the problem was. And she was lamenting and thought, well, she used to be a ballroom dancer with my dad, and people smoked around her, including dad. And she thought it was that. She thought it was harsh cleaning agents, bad living, probably Snicker bars. And I said, Mom, you caught a virus. Okay. Perhaps she was genetically predisposed, but she caught a virus. So I don't know about you, but I'm not always very good at fending off viruses. And that's what happened. Okay. How about another neurological disease? Let's talk about rabies. We're going to come back to him. All right, so there is a video on YouTube. I can only play just a smattering of it. Otherwise, YouTube will cut it off, but you can go to this website and you can watch this.
This group of villagers from the backcountry of Iran were all attacked and bitten by a rabid wolf.
So they were bitten by a rabid wolf, and none of them survived, by the way. And this shows sort of the end stages, and this is horrific. And I'm not going to spend any time on this. I just wanted to let you know that typically you do not survive that. Okay? I just wanted you to know. If you want to watch this, I found this, and I'd never seen a video on a human case of rabies. They're horrible, obviously. This is horrible, and the ones with the animals in them are horrible as well. But if you're interested, there you go. So rabies is caused by a rhabdovirus. It is a bullet-shaped envelope virus, but it doesn't matter if it's envelope because you get it by the bite of a mammal, anything with fur. Bats are big carriers, and it's in fecal material of bats. So if you like to go into caves, and I have a few times myself, you can actually inhale rabies viruses in the dust. The dust just carries bat droppings, and you inhale it. The syndrome is rabies. And okay, so let's say you get bitten, like those poor gentlemen got bitten by a rabid wolf. The virus moves along the peripheral nerves to the central nervous system. This takes quite a long time, actually. It can take 2 weeks to several months, but the average is 8 weeks before you start to see symptoms. So the symptoms include difficulty swallowing, severe nervousness, excitation, and if you've seen dogs like Cujo or, Old Yeller, they lash out because every little piece of stimulation bothers them. A car door shutting, even a breeze, can cause them to go into excruciating pain, and they lash out, and then they bite, and then they pass on the virus to the next host. Interesting how the virus controls its host, right? It can also cause severe headaches and nauseousness. Untreated, it is almost always fatal. In history, in recorded history, there's only probably two exceptions, but let's just say they kind of survived, but not in a great way. So, treatment. Okay, one of the things whenever you get an animal bite, you run over water for about 10 minutes and you rinse, 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 soap and water, but just gently. Soap and water, and then get to a hospital and block the virus. So, typically, you get gamma globulin, pre-made antibodies. They will try to attach to the viruses before they get very far. And then you have to do, I think it's 3 vaccines, one the first day, and then you come back and get a second one. This is a dog with rabies, and they don't always foam at the mouth. Okay, just strange behavior is what you look for. Here we can see this is where he got bit on the leg, and it travels up the peripheral nervous system, up to the central nervous system, and this is tracking where the viruses go. Up, 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 and then back out to everything. So it's horrible. Okay? All right. So I said it's behavior. This raccoon has rabies. You don't believe me? He's not foaming at the mouth. And I don't even have to see his strange behavior. Oh, yes, I am viewing his strange behavior. He is nocturnal and he doesn't like human contact. When you see a wild animal that could care less about the fact that you are out there, or it's nocturnal, supposed to be around only at night, and it's walking around during the day. You need to get your children indoors, get your pets if you can, and you need to call someone. I was in Iowa going to a orchard, and I saw a coyote just walking around and watching my car. And yeah, so I called. Well, I had the locals call somebody to take care of the animal. This is bad. Okay, rabies. Okay, so now let's talk about neurological diseases caused by bacteria, including Lyme disease. Now, here I have a bullseye rash. You do not always see this, okay? You do not always see this. If you do, then you're lucky because then you know you need to seek medical attention right away. Usually you get this little rash right where the tick bit you and injected the bacterial organism. So Lyme is a bacterial pathogen caused by the bacterium known as Borrelia burgdorferi. It is a gram-negative, but only by default. It's a spirochete, so it's all spirally. It's not a true gram-negative. Transmission, again, you get bitten by a tick. Not just any tick. If you're thinking, well, if I would see it if it was a tick. No, not necessarily. They are tiny, tiny, tiny. Most people think that ticks jump out at you from high trees. No, the majority love to be in the grasses, but they will climb up and they love to hide in the hair. That is true. So that's why when you come in from outdoors, you've been rolling around and playing in the grasses, you got to do a tick check and go and just, strip down. It's good to wear white colored clothing so you can see the tick a little more easily if they're trying to crawl, okay, up your tissue. So this just shows you how tiny they can be. Okay, so this is about 1 millimeter. So this is using the metric ruler. Okay, so these are tiny, right? This guy here. Okay, the disease. Once you are bitten, the bacteria spreads from the site of the tick bite to colonize in multiple tissue types. And because it goes everywhere, it causes multi-system clinical manifestations, and it's not always detected. And this is why it's bad. And it will look like a lot of other things, and it may not get diagnosed. This may get into the central nervous system and the peripheral nervous system. The central nervous system involvement may result in diverse symptoms, like I mentioned before, including headache, fatigue, memory loss, learning disabilities, and/or depression. Commonly misdiagnosed as multiple sclerosis. A friend of mine was living in Denver when Lyme disease was first noticed, and she was misdiagnosed for years, so she didn't get it treated quickly with antibiotics. The doctors said, no, the tick doesn't get to Colorado. I was doing research in Wyoming, and the Ixodes damnii tick was, in fact, in Wyoming. It was there, so we figured it was that. I wrote her, I said, get up to Mayo. She did. It was finally diagnosed. She finally got on a lot of antibiotics. She had to be on a pump and carry it around with her. But it was too late. She's a year younger than I, and so she's already on disability, and she has a form of multiple sclerosis, which is a neurodegenerative disease. But had they gotten it fast enough, that would not have been a problem. Like I said, the bullseye rash is not an indicator necessarily. I mean, if you see it, you say, oh my gosh, it's Lyme disease, and you rush and you get your antibiotic. But do not rely on a bullseye rash to diagnose this. Okay? And again, so what happens if you have a tick and you got to get it off? Here is what you need to do. You get a needle nose kind of tweezer. This is very small. Look at these hairs, how big they are. You need to get these tweezers as close to the skin as possible. You do not squeeze the abdomen. Why? Because that's where the bacteria are and the glands. If you squish this, the tick will spit out as much bacteria as possible. You do not want that. So you should pull the tick up and grab it as close to the head as you can get. You do not want the head to remain in the tissue, okay? Don't squeeze, again, you don't want to squeeze the bacteria out of the tick abdomen during removal. In spite of what people have said, do not use ever the petroleum jelly, a hot match, nail polish, or other products. Again, this will allow the bacteria to leach into your tissue more effectively. So what do we do if we do have a tick that gave us Borrelia burgdorferi bacteria? Well, antibiotics. Like tetracyclines, the protein synthesis inhibitors. Remember, those are really good broad spectrums and they will get into all kinds of tissue, but you have to prescribe them early on. Diagnosis is key. And I'll tell you what, it's better to be paranoid. So if you think you had a tick and it was on there too long on you or your child, I'd go in and get it diagnosed as quickly as possible. Sadly, even then, the tests aren't always going to show whether or not you've been exposed. Okay? Try to diagnose it early. Try to diagnose it correctly. If you can, take your antibiotics because you don't want to end up with multiple sclerosis, a form of neurodegenerative disease. Sorry. Okay, so 47-year-old male Iowa farmer presents the following symptoms: arthritis, headache, fever, strange rash, also known as erythema migrans. So what would this be? Q fever, syphilis, trench fever, Lyme disease, Rocky Mountain spotted fever, chlamydia. Okay, yep, Lyme disease. Good. What is the agent? Bartonella henselae, Euchinella corrodens, Borrelia burgdorferi, Borrelia hermsii, Rickettsia, Coxiella burnettii. Boy, look at those vowels. It is Borrelia burgdorferi. It is C. How is the Lyme disease transmitted? Through tick, louse, mosquito, mite, droplet nuclei, or sex. Through a tick. That is correct, A. Let's ask a few other questions. Fever blisters are commonly caused by Human papillomaviruses, polioviruses, adenoviruses, herpes simplex virus 1, herpes simplex virus 2. Well, the typical fever blisters are the ones above the waist, and typically it's herpes simplex virus 1. Okay, but it is possible you might get a lesion from herpes simplex virus 2. But okay, on a test, choose 1. Okay, herpes simplex virus 1. That is the fever blister virus. Epstein-Barr virus is linked to chickenpox, multiple myeloma and bone cancer, mononucleosis, genital herpes, or multiple sclerosis. Okay, remember that one? Mononucleosis, C. Which of the following viruses can infect the tissue of the nervous system? Rabies, herpes simplex virus 1, herpes simplex virus 2, varicella zoster virus, all of the above. All of the above, you betcha. Herpes viruses, varicella zoster is a herpes. So chickenpox shingles is a herpes virus. Yeah, all of them do in fact invade the neurons, the nervous system, okay? Which primarily infects genital mucosal cells and is most closely associated with HIV? Herpes simplex virus 1, herpes simplex virus 2, cytomegalovirus, Epstein-Barr virus, or the rhinovirus. Okay, so that's gotta be herpes simplex virus 2, right? The one below the waist. Okay. What is shingles? Warts are benign tumors, the development of skin lesions all over the body that resemble roof shingles, an acute respiratory infection, activated varicella zoster viruses budding out of nerve endings, the latent form of an adenovirus causing Kaposi sarcoma. It is D, activated varicella zoster viruses budding out of nerve endings. Owie. How about from the previous lecture? Which of the following causes cold-like symptoms of spring fever? Epstein-Barr virus, rhinovirus, CMV, cytomegalovirus, adenovirus, papillomavirus. It is D, the adenovirus or adenovirus. Just saying if you're paying attention. I know, this is sad. Let's talk about other neurological diseases, things that cause meningitis. So, first of all, and you should know there's a lot of viruses that will do this too, but let's talk about bacterial meningitis, okay? By the way, so meningitis is an inflammation of the meninges. Meninges are the covering of the brain. So this is what this is pulling back here, okay? All right, so we're going to look at the bacterial pathogen known as Neisseria meningitidis. It actually is named after the disease that it causes, meningitis. Sometimes you'll hear it referred to as meningococcus. So the reason it's called meningococcus is because this is a diplococcus. Now see the two little red cells connected. The yellow that looks like flames, those are actually toxins being released. So these are gram-negative diplococci. That means they have nasty endotoxins. Interestingly enough, they shed endotoxins as they replicate. And again, shown here as yellow. And the endotoxins, by the way, will travel throughout the circulatory system, causing all kinds of very serious problems. It has a capsule not shown here, but that means it's hard to see by the immune system of an adult. Do you think a child will recognize this? No, it will not. Immunologically, the child is very much at risk. Okay. There are many bacteria that cause bacterial meningitis, Staphylococcus aureus, Streptococcus pyogenes, also some others known as Klebsiella pneumoniae, and several others. But this is the best known agent to cause bacterial meningitis, and we also have a vaccine against it, so that's why we're going to talk about it. Life cycle, basically, it hangs out in the nasopharyngeal area. Okay, and it only infects humans, so it's not going to get into animals, and they're not going to give it to us. So we say it's not zoonotic or zoonotic. Actually, zoonotic is appropriate. It likes to hang out in the mucus. It can actually, in some individuals, be part of the natural flora. So many people are natural carriers of this. because it is encapsulated, or the encapsulated form, I'm sorry, are the invasive forms, and they can go very deep into the tissue and especially get around in immunodeficient children and stressed out college students that live in dorms that party together. Okay, so from there to the meninges and causes inflammation. Again, you don't want areas of the brain inflamed. Okay, how are you going to get blood to everything? That's not good. Okay. So again, so what happens is it moves from the nasopharynx into the circulatory system. It makes its way to the brain at the meninges and causes inflammation there. Now, the patient, by the way, may have some pretty bad symptoms, and the worst thing you can do is say, well, let's just wait on that. We'll just see how you feel in the morning. The patient might think, well, okay, maybe I'll just do that. The patient may not have time to think on it. Also, you do not want to send a patient home who has meningitis symptoms, because that is a lawsuit, and you don't have the time. They don't have the time to be sent home and come back in the morning. Okay? Early diagnosis is crucial. Symptoms include fatigue, fever, severe headache, and neck stiffness, nauseousness, vomiting, and again, some people will just think I have influenza. All right, so here's it might be accompanied by sensitivity to light, confusion, and sleepiness. So here's the thing, you do not wait until the morning. You just suck it up, make the copay, go into the ER. Okay? So it's better to be wrong about this and overreact than underreact. Do not think we'll just wait in the morning. Okay? Now, in an infant, this is even scarier. Infants show fewer signs and are harder to determine. In both cases, this can progress to seizures or even coma or death. Here's one thing that can happen in children. This can cause, what happens is the white blood cells become so sticky, it can cause rupturing of endothelial cells and like blood vessel cells and organ cells. So you bleed out and you get this sort of bleeding out petechial rash. That's blood kind of leaching up to the surface. The damage can be so severe that blood clotting factors move in, and then you no longer get blood circulating to some parts of the body. This can result in a need for amputation. For young children who are fortunate enough to survive, um, sometimes they end up with amputations. Sometimes all four limbs must be amputated as a result. If you go online, there's more than enough gruesome pictures here. I like this one because, was looking kind of on the cheery side and was playing. So anyway, but it's tragic no matter how you address it. Oh, but I want you just to be aware of how serious this is. If bacterial meningitis is suspected, prompt antibiotics must be administered, even if you're not sure if it's bacterial or viral. Antibiotics must be promptly administered. Normally, what they will do is they will do a lumbar puncture, trying to look at spinal fluid. And try to look for diplococci in the spinal fluid. But a lot of times you need to start the antibiotics before absolutely diagnosing that it's bacterial, because it takes a little while to figure that out. Again, if you miss these symptoms, if you send the patient home, this is miss this and it's litigation time. Okay? This is a lawsuit, and you don't want to be a part of that. And hopefully the physicians that you will work with, and maybe you're going to be a nurse practitioner, hopefully everybody will catch this. There is a vaccine that prevent most strains. Yay. Okay, which we like. Okay, here's a question. 27-year-old man presented with a fever of 103 degrees Fahrenheit, delirium, headache, stiff neck. Okay, let's just say that you did, from the spinal fluid, you got gram-negative diplococci. Which etiological agent or which agent would you suspect? Neisseria meningitidis, herpes simplex, Haemophilus influenza, rabies, Staphylococcus aureus. And of course, we're looking at a gram-negative Diplococcus clearly causing meningitis. So Neisseria meningitidis is what you want to go after. And here's the Diplococcus here. All right. By the way, Staphylococcus can also cause meningitis, but they are gram-positive, and they are Staphylococcus. Okay. I know. I will be more specific on a test question if you're thinking, that's awful. It would be, but I'll be more specific, okay? But if you see a gram-negative Diplococcus, know that, okay, we would have already talked about Staphylococcus. I take it back. You would have known that Staphylococcus is a gram-positive coccus, okay? So I'll try to make a strong hint, but you should know that, all right? All right, how about another neurological disease that is actually due to a toxin? Something called tetanospasmin, like tetanus. You know, sometimes the bacterial organism is bad, but the immediate threat is the toxins they are manufacturing. If the bacterial organism is secreting like exotoxins or even endotoxins, that is something you must address right away. Okay? So it's the toxins and not necessarily the cell itself that made the toxins that we worry about. This, by the way, is a classic drawing illustration by Dr. Bell. This is in a Scottish museum in Edinburgh. I saw this firsthand and I looked up and I was taken aback. It's like, oh my gosh, I've been looking at this in textbooks forever, and there it is. But this is someone who is on a battlefield in the 1800s, and you can tell he's just clenched. But what you don't see is there's spasms going on here. He's not only clenched up, but there's spasms that will break bones. So this toxin, the tetanospasmin, is caused by tetanus. Tetanus, tetanus is the disease. The pathogen is Clostridium tetani, sorry. Clostridium tetani is a gram-positive endospore-forming rod. Because there are endospores, they can end up everywhere in the dust, and anything that's dusty, they blow around forever. So transmission is of the endospores in the soil, in the dust blowing around. The bacterial organism produces an exotoxin, which is a neurotoxin. Now, there's a lot of Clostridium bacteria that produce toxins and even neurotoxins. Clostridium botulinum goes to peripheral nerves and will paralyze those peripheral nerves, but Clostridium tetani tetanus toxin is going to go, it's going to go to spinal cord neurons. And it's going to affect a unique neurotransmitter known as GABA. So the tetanus toxin gets in, okay, and it blocks the release of the neurotransmitter GABA. Now, what does GABA normally do? What's supposed to happen in the central nervous system? GABA is released, and that is supposed to inhibit especially motor neuron contraction. What if the toxin is there and GABA is not released? Well, then you're going to have some motor neuron contraction. The patient cannot suppress motor neurons and muscle activity. You get lockjaw, you get muscles that contract uncontrollably, and it will break bones. So usually the patient has to be tied down. And here is a more modern illustration of this, and it's horrific. This toxin, if you cannot stop it immediately, it will kill the patient. Luckily, there is a vaccine, a toxoid vaccine, to stop the tetanus toxin. Here are the bacteria. There are the endospores inside. When these are released, they last forever. But when it's just a bacterial cell, they will release these toxins that will do this. Okay? All right. Rusty nail, is this necessary? No. You don't need a silly rusty nail in order to get tetanus. Any breach of the skin will do. If there's dust somewhere, got dust somewhere? Okay. Well, if it gets into a wound, you can have Clostridium tetani get into the wound, and it will release the tetanospasmin toxin. Okay, this organism produces an exotoxin that affects the central nervous system, causing spastic paralysis and respiratory arrest. I didn't mention that, but it will. Clostridium perfringens, Clostridium tetani, Clostridium difficile, Clostridium botulinum, Bacillus anthracis, Bacillus cereus. Right, this is tetanus with tetanospasmin. So it's B, Clostridium tetani. Notice how all of these are listed together. All of these are gram-positive endospore formers, and they all make exotoxins. Clostridium perfringens causes gas gangrene. Clostridium tetani causes lockjaw or tetanus. Clostridium difficile causes C. diff. We'll talk about that. I won't go further than that. Or is C. diff, sorry. And it causes some terrible GI problems. Clostridium botulinum causes botulism. One of you knows this. Okay, but these are peripheral nerves, and this is a different neurotransmitter, right? Yeah. Okay. What are the typical symptoms of bacterial meningitis and should have you heading towards the hospital? Vomiting and diarrhea, severe fever with rash, stiff neck and severe headache, a bullseye rash, cankers or chancres. Stiff neck and severe headache. Just making sure you're paying attention. All right. These are Staphylococcus aureus bacterial cells, and this is taken with a scanning electron micrograph. So they're huge. They're very magnified. They're 3D. Understand though, staph, if I say the word staph, that covers a whole lot of syndromes that are going to cover a whole bunch of systems. You know, up till now, we've kind of put things into compartments like, okay, respiratory, skin diseases, neurological symptoms. Okay, we're going to put it all together. Staph will cause it all. So I'm throwing this in here now. All right. So let's begin by talking about the word staph. Did you know that there are actually 3 medically significant Staphylococcus genera? Meaning their first name is Staphylococcus. Okay, and they're medically significant. So first we have, and this is the abbreviation, Staphylococcus saprophyticus. This causes urinary tract infections, especially in women. There's also Staphylococcus epidermidis. This can cause endocarditis, heart. Okay, and Staphylococcus aureus is the one we tend to think about when we talk about gram-positive cocci or staph infections. These are primary pathogens both at home and in the hospital, and they do it all. But all of these are gram-positive cocci, stained purple, big outer cell wall. They make a host of exotoxins. You can have many within the same species, but not all have the genes to make the toxins. So you can have Staphylococcus aureus and never get sick, and another strain of Staphylococcus aureus, and because of the genes it carries, it'll kill you. Plain and simple. All right. So how about morphology? These can make capsules, and therefore they can avoid your immune response. They are pyogenic. What does that mean? They generate pus. In fact, they are very good at producing abscesses. What's an abscess? It's an infection producing pus. It's going to cause all that inflammation to go with it, swelling, pain, redness. If it's on the exterior, you can see that. Now, Staphylococcus aureus and Streptococcus pyogenes, also known as Group A strep, Streptococcus pyogenes is Group A strep, they share an awful lot of characteristics. Sometimes they make very similar toxins and cause very similar syndromes/diseases. So, yeah, a lot of things that I talk about regarding Staphylococcus aureus will relate also to strep, and I will mention that on the side. You don't need to know that for the test, but one of you will probably pay attention, so especially. So let's just talk about Staphylococcus aureus. By the way, 1/3 of all humans carry this. So you have a 33.33% chance probably of being a carrier of Staphylococcus aureus. And it's part of your normal microbiota. Okay? Found on the skin, nasal passages, and in the rectum as well. A lot of them might have genes to make enzymes that will cause some damage. And here you can see a real typical staph infection on the skin. So let's talk about some of the toxins and enzymes that these bacteria make. Nearly all strains of Staphylococcus aureus will secrete a lot of different enzymes and cell toxins. Sometimes we call those cytotoxins, cell toxins or cytotoxins. It may not be a big deal for a lot of people, and again, it depends on how many genes they carry. They may only make a few toxins or enzymes, and they may not be really bad. We might be able to do okay repairing and fighting it off. Or they might make a whole bunch of enzymes and toxins, and they're really nasty ones. And okay, you end up with something horrible like that, poor thing. So let's talk about an enzyme that explodes red blood cells. These are called hemolysins. Here is an example of regular red blood cells. Here's a red blood cell that has holes in it. And this would be what would happen if this red blood cell was exposed to a Staph aureus hemolysin. Okay, full disclosure. This is actually not caused by Staphylococcus aureus hemolysin. Okay. But I wanted to show you this would be how it would look, okay? So full disclosure, I don't want to mislead you. Okay, Staph aureus might also have genes that allow it to make an enzyme called a protease. That would be an enzyme that breaks down protein in the tissue. Good for invasion. Lipases allow it to break down lipids. So it's an enzyme that breaks down lipids. And again, it allows it to spread, and also get some good food out of you. There's really a horribly long enzyme called hyaluronidase. When they release this in something called collagenase, it breaks down the connections between cells and the connective tissue, like the collagen, and breaks it down. So your skin kind of peels away. Okay? Not good. So we call the hyaluronidase, by the way, an exfoliative toxin, and maybe you can kind of see it peel away on the edges. It almost looks like a sunburn. Okay, it's peeling off. So exfoliation, ladies, if you've ever, or if there was a guy too, sometimes we want to get rid of the dead skin cells, and we add something for exfoliation. All right, well, this is a toxin doing it, and it's not good. All right, Staphylococcus aureus will also produce staphylococcal intestinal toxins. Because they affect the intestines, these are called enterotoxins. Here's the deal, very heat stable. So if you have food contaminated with Staph aureus toxins, heat isn't going to have an impact on it, at least not with normal heating methods. Sometimes they make leukocidins. Leuko is like white blood cell. So what does this do? Well, the Staph aureus will secrete these toxins that will kill white blood cells, especially the neutrophils, and that's why you get a lot of the pus, by the way. Some strains will have particular antigens. Antigens are anything that generates an immune response, but their antigens are going to produce a strong defense, and we call those super antigens. Do you remember? So some strains will cause toxic shock syndrome, okay, if they can make toxic shock syndrome toxin, TSST. By the way, group A strep will also produce TSST toxins that are super antigens. Okay. So all of these are used for them to survive, to spread, and to convert host tissue, your tissue, into nutrients. But again, a third of the population have Staph aureus, and they don't get all of this. It's all about their genes and also your defenses. Okay? So Staphylococcus aureus diseases can manifest themselves in two ways. First of all, you can have a localized disease. So this would be things like boils, pimples, styes, basically abscesses, surgical wound infections. They're all filled with pus and may often leave a scar and scar tissue. They can go systemic, spreading from a local lesion due to a breakdown in the inflammatory barrier. So remember, some of these chemicals, if they break through, they can spread throughout the whole body and go systemic. By the way, when you do an ear piercing, the one thing you do is you keep that wound open. So sometimes people will get Staph aureus coming in from the skin, and it will travel through the blood and cause a systemic infection. All right, so the first thing I'm gonna talk about is the localized diseases of Staphylococcus aureus, including this. This is pustular impetigo, sometimes just known as impetigo. It is superficial. You get these crusty little pustules, and they will rupture. They easily spread, and this is from a football helmet. A lot of athletes get this off of athletic equipment, and the chin strap is one place to really spread this. So some of you, if you have kids out there, you might have seen this. This one, and I know I don't look like looking at babies that are sick, but there we are. This is called scalded skin syndrome. And again, this is a localized staph infection. The redness is all over the body. This is caused by the Staph aureus toxins. Here you can see the exfoliation and the toxin action because of it. So the antibiotics might kill the bacterial cell, but the toxins that are released are exotoxins and they travel all throughout the whole body and cause this exfoliation. Okay, so the antibiotics aren't going to help with exfoliation. So the blisters, they do slough off, and again, it looks like a sunburn. Staph will do this a lot. So the same with group A strep. Um, Again, it's you don't really see the organism doing this, and you don't see the pus, interestingly enough, because again, it's all about the toxin. Um, when does the healing start? It heals after some antibodies form to the toxin. So the baby has to form it has to go through the humoral response to the toxins, to the Staph aureus toxin, and they will neutralize it. Oops, sorry. And this is very superficial. But again, it may be self-limiting, but it could cause other complications. Okay. Um, and it especially depends on if the child has other predisposing factors. So if the infant was born with other problems, this can be an issue. All right. This is a great illustration of cellulitis. So here we have clearly the Staph aureus got in through some wound and it was infected, and you can see it traveling up here. So you may see something like this. You might see a huge red rash, but this is cellulitis. It affects the skin, not in the superficial layers, but in deeper layers, the dermis and the subcutaneous tissue. Oh, sorry, that wasn't supposed to go there. This is also superficial. Okay, now what happens? How does staph go systemic? Go from something superficial, maybe to something like this. Okay, how does that happen? Well, okay, so systemic staph usually starts with an abscess. Maybe it's a dental abscess or a catheter. This is Staphylococcus aureus on a piece of catheter. And a catheter is in a natural opening, usually in the body, especially a suprapubic catheter. And so that's an easy way for them to get in. IV drugs, this will move Staphylococcus aureus through the circulatory system. Squeezing a boil. So take a look at this. So this is an abscess, a boil, and you have that tough keratin layer on this side. The connective tissue below this is much more fragile. If I try to pop this and squeeze it, maybe some of the pus and bacteria and other fluid will come out, but a lot of bacteria will probably be injected into the tissue. And that certainly can cause a systemic infection. By the way, release of staph in the bloodstream is commonly known as blood poisoning. So squeezing this, squeezing this, or by any other route, if the bacteria somehow manage themselves to break through these barriers, usually set up by the immune response, but if they break through this, they can set up a systemic bacteremia. Here is a pre and post-op picture. This is actually a friend of mine, and he said he didn't care because who would know? but he's actually a businessman and he's flying all the time. He probably picked up some nasty strains of Staphylococcus aureus, maybe while flying on an international flight. But anyway, he let this go just a little too long. Know any guys like that? I know, we love them anyway, don't we? So clearly this is filled with lots of abscesses. Even post-surgically, you can see all the dead neutrophils moving in, but there's still a lot of bacteria and toxins in there. He's all better now. Okay. Hopefully you were needing, right? Okay. So who is predisposed of getting a systemic Staph aureus infection? You know, some people can squeeze a boil and there's not a problem, but some people do get bacteremia and a systemic problem. Um, your patients with diabetes, sickle cell disease, someone who has a immune deficiency like AIDS, if they're undergoing chemotherapy for cancers or cancer, rheumatoid arthritis, IV drug users, alcoholism, long-term use of steroids, someone undergoing hemodialysis, they got just have poor blood supply comes back to diabetes, or recent injury. Don't ask me how he got it, because he's none of those. But again, maybe just flying and stressed out, from all the travel that he does. So this, by the way, okay, so once the bacteria get into the blood, you get bacteremia, and here you can see it here. Also, again, aka blood poisoning. This is when large numbers of bacteria are released into the blood through all of those mechanisms that I mentioned earlier, and the immune system cannot keep up. So the bacteria travel and they will form abscesses throughout the whole body. Almost all organ systems can be affected. Usually you're going to get inflammation, and the type of inflammation is going to be named for where it came from, basically. So whatever organ or organ system you're talking about, if there's an inflammation there, you're going to say, okay, this organ or organ system, and then end it by itis. That will be the suffix. So, for example, osteomyelitis. So the bacteria travel through the bloodstream, like here, and somehow they manage to get into the bone, any bone. That is osteomyelitis. Okay, into the bone marrow. By the way, of all the types of osteomyelitis, because you're probably thinking, is all osteomyelitis caused by Staphylococcus aureus? No, it can be caused by a lot of things. A lot of bacteria and even some viruses, but Staphylococcus aureus is the #1 cause of osteomyelitis. Okay, endocarditis. So it gets from here, travels down to the heart and gets into the heart valves and lining. That is endocarditis. Again, is this the only cause of endocarditis? No. Viruses, bacteria of many sorts can get in and inflame that area and cause endocarditis, but this is a common cause of it. Meningitis. I already mentioned Staph aureus. Well, there's viruses and there's other bacteria that can cause meningitis, but Staph aureus can get in there as well. And again, meningitis is an inflammation of the brain, the lining around the brain. Nephritis, they got into the kidneys. Okay. Normally, though, it's the toxins that get in there. Pneumonia, well, this usually means you have multiple abscesses in the lungs. Usually, it tends to be a secondary invader after, like somebody had influenza and they got a bacterial infection of Staphylococcus aureus. And because the immune system's so depressed, it can get into the lungs. Okay. And often this is the fatal form. So, and whenever your patient is immunosuppressed, they're very susceptible, once again, to Staphylococcus aureus, especially the systemic infections. Like I said, I have these names. Let me just back up. Osteomyelitis, endocarditis, meningitis, nephritis, pneumonia, all of those. Understand so many things can cause inflammation of those organs and cause those names, those syndromes with their associated symptoms. But, Staphylococcus aureus is just very common. So, yes, all of these can be caused by viruses, fungi, other bacteria, absolutely, especially group A strep. Okay? All right. So, a squeeze boil that loads up your bloodstream with bacteria would cause a condition called Food poisoning, blood poisoning, nephritis, localized infection, or MRSA? B, blood poisoning is correct. Okay, so let's just kind of quickly go through what can happen. So think about all the bones, and yes, Staphylococcus aureus is very good at getting in and causing osteomyelitis. Usually the symptoms include fever, irritability, and fatigue, as well as nauseousness, tenderness, and redness. If you look down here, warmth in the area of the infection. Swelling around the affected bone, loss range of motion, all of those would be typical. Oh, sorry. And I just wanted to show you again, there are many things, not just Staphylococcus aureus, but a lot of others that can cause this, that can cause osteomyelitis. Infective endocarditis, this is the infection of the endocardium, and symptoms include fever, heart murmurs, petechia, remember that's the rash, blood vessels kind of opening up, and you get the blood rash kind of thing showing up. Also anemia, oh, there we are, petechia. It can cause embolisms like blood clots, yep, and a whole lot more. Again, can other things other than Staph aureus cause this? Yes, but they're very good. And here we have the inflammation, and it even looks pussy, which of course Staphylococcus aureus would do. Usually, and you don't have to know this, this is FYI only, you take blood cultures and do an endocardiography. Treatment, antibiotics, of course. ABX, this is what I mean by antibiotic treatment. Sometimes surgery is necessary. So what's causing this again? So the normal heart, just so you know, a normal heart is going to be resistant to all of this. But two factors that kind of are going to predispose you to endocarditis, especially due to Staphylococcus aureus. This could mean that your endocardium is a little abnormal, but again, if you have a lot of bacteria in the blood, bacteremia, there you go. All right. Let's talk about staphylococcal meningitis. Note the pus. Very pussy. We did not see that with Neisseria meningitidis, did we? Nope. Okay. Let's talk about staphylococcal toxic shock syndrome. Most of the things that I am going to mention also relate to group A strep or Streptococcus pyogenes. So this would be a type of Staphylococcus aureus that is releasing an exotoxin that is a super toxin. Do you remember this illustration? You have an antigen presenting cell. I'm sorry, I didn't mean for all this to come up, but just look over here. So this would be like a dendritic cell presenting an antigen to the T cell to start cell-mediated immunity. If there's an exotoxin from Staph aureus or group A strep, this will trigger a huge inflammatory response and it will produce toxic shock syndrome. So staphylococcal toxic shock syndrome, first named and described in 1978. There were many reported cases that were, again, they were they were seeing this in women, but it took them a while to relate this to menstruation. And I'm sorry, there's not a close to those parentheses. But a little bit later on, in 1980, there were about 300 cases and 25 deaths of women in the first 5 months, all related to a super absorbent tampon. Okay, so some tampon makers were using this material that just kept absorbing, the menstrual blood. And women then, and mind you, Staphylococcus aureus is in the vagina, and then you insert a tampon, and you have all this warmth and blood and fluid, all these nutrients. And if there's Staph aureus there, they're going to have a good old time. I'm sorry, they are. And the toxins they can produce are deadly. Okay. So women were not changing their tampons, and this is one of the conditions that was occurring. Okay, so the bacteria that were here, that were living around where the tampon was inserted. They were secreting exotoxins, which were super toxins, which caused, again, these were super antigens, and they caused toxic shock syndrome. Symptoms, well, they're due to the toxin. They're pretty rapid. Within 12 to 24 hours, it includes a high fever, muscle pain, vomiting, diarrhea, drop in blood pressure, including shock. That's how they died. And the sunburn rash is a very good indicator. Again, Staph aureus and group A strep as well will put out those exfoliating toxins. That's a big, that's a big key, and it just looks like a big rash. These aren't the only things that do this, but it is a big indicator. So the sunburn-like rash will peel in about a week, particularly on the palms of the hands, soles of the feet, due to the production of the exfoliation toxins. Okay. And again, these symptoms are going to be due to the toxins. Bad, bad, bad. Some of the toxins, if they get into the food, will cause food poisoning. Oh, yeah. So we're going to go there. Most of the time, it's food handlers that cause all types of food poisoning. So if you have any symptoms, either one of these or the other, or both, it's probably due to food handlers. But understand buffets, and I'm just going to ruin your day here. So buffets, these steam tables are warm, but not too warm. And they have, nice steam and moisture and all those nutrients. And this is perfect. And people who are carrying staph, well, easily they can fall off from the skin cells onto the food. And there are sneeze guards, but notice this little one, she's underneath the sneeze guard. So what happens here, and this is true of Staph aureus, but it's true of a few other pathogens, bacterial pathogens. So they grow in the foods and they make particular exotoxins that impact the intestines. So they are also enterotoxins. So they're exo, meaning they're excreted, but since they affect the intestines, they're enterotoxins as well. So they're both. They're excreted and they affect the intestines. So usually significant amounts of toxins can be made just within 2 to 4 hours of inoculation. So once a food handler or a customer drops some bacteria in there, you can make huge amounts of toxins just within a few hours. So letting food sit out, by the way, not a good idea. It's especially Staph aureus, and its toxins are especially common in foods handled and held at room temperature. They especially love foods high in carbohydrates. So, Chinese buffets, pasta bars, things like that, all are high in carbohydrates. This is not to say that proteins can't have other bacteria in them, but Staph aureus loves the carbs. Oh, yeah. If you're thinking, well, I can probably taste it or smell it. No, you can't. These toxins, odorless, tasteless, and you can't really tell by appearance. And they are heat resistant. So you take it home, you try to heat it up. If the toxins are already made, it's too late to kill the bacteria. So let's say this has been sitting out forever and you're thinking, okay, I better heat this up to kill everything. Yeah, you might kill Staph aureus, but the toxins will remain, and the toxins are heat resistant. So you take home a doggy bag, and voila, this is you. Staph aureus, the toxins will produce a pretty rapid onset of symptoms, 2 to 6 hours. The toxins will affect the central nervous system, the vomiting center, and you get nauseousness, vomiting, and diarrhea, lovingly known as the double bucket flu. If you have ever gone through this, you know that it has to run its course, but you just think, oh, somebody kill me now. So yes, it's pretty violent for about a day, and then it just takes a long time to recover. You're not going to have a fever, and relative recovery is within 24 to 48 hours. 48 hours if it's pretty severe. If you went 48 hours, you might want to get hospitalized and make sure that you do not, that you don't go into shock because of dehydration. The toxin, like I said, is heat stable and you can't taste it or smell it or notice it's there. Yay. So is this going to work? I have a brother who loves to microwave everything, wait, something that's been sitting there forever. And so there looks like some cheese, maybe some noodles and peas and things like that. So yeah, you can microwave it. By the way, microwaves do not heat everything up evenly. So you'll have to cook it a very long time, let it sit there, and it might kill the bacterial cells, but will it work on the toxins? No, probably not. Okay, so Staphylococcus aureus shares syndromes with group A strep or Streptococcus pyogenes. Both, and you don't need to know this, this is FYI. So Streptococcus pyogenes or group A strep will cause streptococcal scarlet fever because of toxins. Streptococcal toxic shock syndrome due to the toxins. Yeah, and then there's staphylococcal scarlet fever and staphylococcal toxic shock syndrome. So they do share an awful lot. Okay, so staphylococcal food poisoning is most commonly due to A, food processing, handling in unsanitary ways, B, animal tissue naturally loaded with pathogens, C, overcooked foods, D, vegetables, E, meats. Now, staph again prefers kind of the carbohydrates, and normally it's food processing, and this is true of all foodborne disorders. It's usually the food handlers processing, refrigeration, heating, something like that. But also, if I had a question or an answer in there that said toxins, go with toxins. Okay, so some terms that I want to talk about, and just as far as how prevalent or how common is Staph aureus. You know, we know that Staph aureus is again found in about a third of all people. We used to think that, but all the serious strains of Staphylococcus aureus were acquired while in the hospital. That is no longer true. We have a lot of community-acquired Staphylococcus aureus problems. Some really nasty strains of Staph aureus. But yeah, it is certainly a major hospital problem because it does pass from patient to patient, but most especially from employee to patient. Employers are the ones going from room to room to room. Understand these microbes are very hardy, they are very good little mutators, and of course, some of the mutations allow them to be resistant to a lot of antibiotics, like our beta-lactam drugs. So if you remember, we had MRSA, which is methicillin-resistant Staph aureus. What is the difference between MRSA Staph aureus and regular Staph aureus? A gene, maybe a few. This is the same, this is still Staph aureus, gram-positive cocci bacteria, but they have genes that allow them to not respond to an antibiotic. Okay. Now, you may have on a chart, in addition to seeing MRSA, you might see HA MRSA or CA MRSA. Now, what is that? So, HA MRSA is hospital-acquired MRSA. CA is community-acquired MRSA. All right. So what do we do to treat Staphylococcus aureus? Well, if there's a big abscess, you drain it. And sometimes, again, you want to ideally do antibiotic sensitivity tests to see if the antibiotic you find will work on your strain of Staph aureus. Sometimes you try one and, it doesn't work. Unfortunately, they don't always do antibiotic sensitivity tests. They just say, let's just give you beta-lactam. Hopefully this is going to work. And the thing is if you're going to administer antibiotics, vigorously administer them until certain of a cure. Sometimes you need to pack a wound with antibiotic strips. If you've never done that before, let me tell you, it's just delightful. Nah, you just suck it up. It's like everything else. There is no vaccine for Staph aureus. And again, you have to use extra caution in hospitals. In hospitals, especially, you have to detect and treat nasal carriers amongst employees. This is especially true if they're carrying a resistant strain or if they work in a nursery or with debilitated patients. So, for example, in ICU. Okay, so question, hemolysis. What does that mean? Oh, particularly if you see the word beta in front of it. This is something that happens with certain bacteria like group A strep and Staphylococcus aureus. They will release enzymes called hemolysins that cause hemolysis. So what does that mean? A, bacterial cells are lysed. B, bacterial cells change color. C, there is a decrease in red blood cell counts. D, red blood cells are lysed. E, there is a decrease in white blood cell counts. F, red blood cells clump together. Well, of course, hemolysis, red blood cells are lysed. They explode, right? Probably didn't show up. Okay, and again, Staphylococcus aureus and also group A strep, just FYI, also produce hemolysins that cause hemolysis. So imagine what that's going to do to your blood cell count in the body. Okay. If you have a staphylococcal boil, you should A, get vaccinated, B, squeeze out the pus, C, lance the boil, D, take MRSA. And I didn't really talk about that E. A and B are correct. So actually you lance the boil. I didn't really talk about that. But yeah, don't squeeze out the pus because that will give you what? Blood poisoning, that is correct. You don't want bacteremia. So lancing the boil, probably packing it with an antibiotic. Okay, packing material. Okay, take MRSA, please. Okay. Toxic shock syndrome is caused by Staphylococcus aureus, Streptococcus pyogenes, Haemophilus influenza, Corynebacteria diphtheria, or A and B are correct. And of course, well, even though this isn't labeled, Staphylococcus aureus and Streptococcus pyogenes both caused toxic shock syndrome. On a test, I would only include Staph aureus as an option. All right, which of the following would describe a staphylococcal staph infection of the heart? Osteomyelitis, endocarditis, meningitis, nephritis, pneumonia. And of course, that's got to be endocarditis. Is Staphylococcus aureus the only one to cause endocarditis? No. Other bacteria and viruses and other things can impact the endocardium and cause inflammation and therefore cause endocarditis. But on some patients, this is something that if they're immunosuppressed or have problems, this might be something they have. Okay, so let's leave the Staph aureus. And, if you noticed, it caused an awful lot of problems, including causing food poisoning. So food poisoning is just a disease of the GI tract. Now, whenever you have GI symptoms, cramping, diarrhea, all of those are pretty much attributed to bacteria, viruses, and maybe some parasites as well. Okay. And these are all organisms pretty much that travel the fecal oral transmission route. So that means basically you have fecal contamination and that results in vomiting and diarrhea. Is there anything else that causes vomiting and diarrhea? Nasty chemicals, I suppose. Okay. Or something going on with the brain. Okay, the big one, another Clostridium. And again, all Clostridiums are gram-positive endospore formers, and they all pretty much make some pretty nasty exotoxins as well. Clostridium difficile is also lovingly known as C. diff. Yeah, that's a joke. So Clostridium difficile, the morphology gram-positive endospore-forming bacteria. So these spore-forming rods are most commonly found in the soil, but can be found everywhere. Okay, transmission and cause. So fecal oral, right? The spores are everywhere. You don't see them, you don't smell them. There is absolutely no way for you to tell they are there. And they can fit into the tiniest microscopic little crevice. You do not know. For a lot of people, these are part of their normal microbiota, but there's no disease. So they might have a C. diff infection, but no C. diff disease. So yeah, it just can be found in healthy people. So why don't they have disease? Because of the rest of the normal microbiota. The rest of the normal microbiota, okay, will keep C. diff at bay. But then, okay, let's say your poor patient has to take antibiotics, and they do. But antibiotics, what's it going to kill? Well, the wimpy ones, okay, so gram positives, then the gram negatives. Who's left? Oh, yeah, endospore formers. So broad spectrum antibiotics are a big cause, but sometimes you got to take them. All right. So antibiotics will kill everything, but probably leave C. diff unless you have a very particular kind of antibiotic like vancomycin, and sometimes metronidazole is used as well. So I don't know why there's a they. They take over if the other bacteria in the normal microbiota are wiped out and C. diff is left, then C. diff will take over, and they do tend to hang out in the gut because it's fecal oral. So they take over the gut and cause inflammation. So what are the symptoms of this? It is the most common cause of diarrhea after antibiotic therapy. So diarrhea, loose, watery stools, or again, what we call diarrhea. And it is severe. It can be quite severe in many cases. With that, nauseousness, painful cramps in the stomach. The diarrhea, the bowel movements are foul smelling. And again, very loose. It can also cause an abnormal heart rhythm, and also blood in the stools is one of the things that you might see. So really, when you're getting these complications of C. diff, in addition to diarrhea, you might have such an inflammatory response in your colon that you get something called pseudomembranous colitis. Okay, let's break it down. Colitis is an inflammation of the colon. That's where these guys are. So they've taken over and they're causing an inflammation, and they're going to form a pseudo or fake membrane. So this and some bacteria will do this. They form this film and you cannot remove it. It's just part of the inflamed tissue and of the large intestine. So it's just all of this inflamed tissue. So this is pseudomembranous colitis. Now, yeah, and again, this is usually going to occur after antibiotic therapy. This can actually progress into something even worse. Sorry. And this is called toxic megacolon. This is life-threatening, and it is quite the complication of other intestinal conditions. So you get an inflated colon. These guys, by the way, are fermenters. Fermenters are going to cause gas, but also inflated colons. So abdominal distension, sometimes fever, abdominal pain, and might even put you into shock if you go into sepsis. Sepsis will occur if there's overwhelming infection in the bloodstream. And remember, these guys produce toxins. If that leaks into the bloodstream, there you go. Okay. Treatments, well, all right. Stop the antibiotics that you're already taking. Okay. Treat for dehydration. And then the antibiotics, you are going to have to kill the bacteria, although the inflammation's already going, but the bacteria do have to go. And well, it's going to be tough to treat. Usually they start Flagyl or vancomycin. That's what they use if for sure they know that it is, in fact, C. diff. So there's Flagyl and Vanc. Flagyl is metronidazole, if you forgot. So after the antibiotics, serious probiotics, you're going to have to get something back in there. So are you sure after all these antibiotics that you've killed all the C. diff and gotten rid of the endospores? Yeah, not so much. So you might always be colonized, so you need to get other bacteria in there. So probiotics, you need a lot of bacteria, so many that they can get past the stomach acids and get to the colon, and you're going to have to take them regularly. And probably, with these guys, by the way, I do take this. Um, you have to feed them like vegetable matter. They'll like that. So feed your friends. The reason I have these, I don't have stock in the company, but I was at Natural Grocers, which is my favorite place to get natural produce and meats. I like their philosophies, but they do sell this, and it is an arm and a leg if you want to buy it. But I went the other day because I was running out, and to my dismay, they were out. And one of the guys there said, "Oh, are you a patient of Dr. So-and-so?" I said, I don't know who that is. He said, "Oh, yeah, he's an Omaha gastroenterologist, and all of his patients come marching in here." So I'm thinking he was a Methodist gastroenterologist because this was the Natural Grocers right about 78th and Dot Street. So doggone it. But anyway, so okay, this may not be fast enough. So fecal transplants, oh joy. So this is one way to know how well you love your partner. Chances are, if you cohabit with somebody, live in the same place with somebody for a long period of time, you will probably have similar normal microbiota. If you wipe all of yours out because you took many antibiotics, there is a potential of getting your good guys back by taking fecal matter from your partner, cohabiter, whatever you want to say. Usually, yeah, they're trying to make this, usually it's like a NG tube, and they try to feed it in that way. They do this more often than I ever imagined. But hey, I'll tell you what, if you were a patient and you are suffering from C. diff, you probably are thinking, I'll take it. Okay, so to prevent the spread of C. diff, I love this cartoon. Wash hands. Okay, I wish there were alarms here. Only use antibiotics when necessary and don't abuse them. Use good disinfectants. Should be disinfectants. I'm sorry, when cleaning your bathroom, kitchen, and other areas. But is this going to sterilize? No. The best way is just wash. Wash the endospores down the sink as best you can. Use universal precautions. Take care of your patients. Do not spread it from room to room. I think I mentioned my brother died of two things. He died of C. diff and Pseudomonas aeruginosa, and he acquired both of them in the hospital. So he didn't have them. He went in, and somebody, probably, let's face it, it was a staff member, a hospital staff member, gave it to him, and he didn't leave. He did have predisposing problems. He was a quadriplegic, but there you go. Okay, so which agent causes pseudomembranous colitis? Which of these? Clostridium perfringens, Clostridium difficile, E. coli, varicella zoster, Staphylococcus aureus, Neisseria meningitidis. Okay, well, it's between the two, and it is C. diff, Clostridium difficile B. How can you tell if you have C. diff endospores on your hands as you leave the hospital? I should mention, by the way, when talking to the nurses and the nurse who also work at Clarkson Hospital, I said, "What do you want me to talk about?" They said Clostridium. I said, "Okay, which kind of Clostridium?" All of them. So notice I'm spending a lot of time with Clostridium. How can you tell if you have a Clostridium difficile endospore on your hand as you leave the hospital? Smell, discoloration of the skin, tingling of the skin. D, there's absolutely no way to know. Okay, no matter what. How can you be certain that you don't have C. diff endospores on your hands as you go from hospital room to hospital room? Smell, I don't know what that, sorry. Uh, okay, not sure what that was supposed to be. Smell, use Purell hand sanitizer, wash with soap and water, none are certain. Well, certainly washing endospores down the sink is the best way. You can't sterilize your hands, you guys. You cannot. Nothing is going to do that unless you want to cut off your hands and throw them into the incubator or into the autoclave. Sorry, not the incubator, the autoclave. Purell definitely won't work, and you know this as healthcare professionals. But seriously, it will not work at all. So washing with soap and water gets everything broken up and down the sink, and that's the best, but none are certain. So again, we use all universal precautions with our patients. Oh, sorry. Okay, so where can I find C. diff endospores? In feces, on a handrail, on a cup, on a faucet handle in the break room, on an elevator button, on the bottom of your purse, on the bottom of your shoe, or how about anywhere? Yeah, anywhere. And probably most of you carry this around with you all the time. Okay? We're going to talk about parasites now. Okay, GI tract parasites. A lot of them do get in through the GI tract. I'm going to briefly mention another type, but parasite. Now, the biological definition of a parasite is anything that depends on a host, benefits from the host, but harms the host. Okay, that's sort of a biological definition. A microbial definition is usually again, it's something that depends on a host, may harm a host, but it's usually like a worm or a protozoan. So usually when we talk about parasites in a microbiological way, we're not talking about bacteria or viruses, even though they are defined as parasites under biological definitions, okay? So if you hear parasite, think worm or protozoan. Okay, wanted to quote A good parasite doesn't kill its host because then well, that's not good. And also, you can eat your parasites, cook them thoroughly first. This is from my parasitology professor, who's no longer with us. UNO Dr. Lunt, and he's gone. By the way, this is Tickles the tapeworm, one of my favorite icons. Yeah. So you wondered where tapeworms were coming in, didn't you? Yeah, listen to the My Tapeworm song. Okay, so protozoan and worm parasites. Let's talk about those. Understand both of these are eukaryotic, just like you. If these are and stay in the GI tract, then the drugs you take, which are poisons, can be designed to stay in the gut so they don't get to the kidneys or the liver or something like that. They tend not to be very toxic. But if these protozoans or worms get into the circulatory system, go systemic, okay, how are you going to design a poison to poison them and not the host? And that is a challenge. Okay. There are many, and the first ones I hesitated to talk about, especially this one, because you're not likely to encounter this, but because it was big in the news, maybe you needed to know about this. So we're going to talk about protozoans that are parasites. Now, protozoans are single-celled eukaryotes, so they have a nucleus, just like you, but they're single-celled, and they might have flagella or cilia or nothing at all to move around in. But they do make some pretty good parasites. I wish we had time for malaria. Malaria is the number one like protozoan killer on this planet. In fact, it kills more people than just about anything else except for, I believe, AIDS. So it's quite the killer when it comes to infectious diseases. Sorry. So the first protozoan I'm going to talk about are amoeba, and they get around by false feet or pseudopods, which are just cytoplasmic extensions. So they look like just blobby eukaryotic cells. And the first kind of amoeba that I'm going to talk about is Naegleria fowleri, and it causes amoebic meningitis. So, okay, what happens is your patient comes in, they have a stiff neck, a headache, and the doctor again thinks, oh my goodness, this is a lawsuit. I've got to give them antibiotics. That won't work. This is amoeba. This is eukaryotic. You need something that will kill amoeba. And by the way, flagell might probably do the trick for this one. This is where really important histories come in. So when you're asking patients, where have you been? What have you been doing? This is really important because if they were in swimming around and dunking their heads underneath thermal pool water, like they were up hiking in Montana or Wyoming, and they were in a natural hot springs and they stuck their head under the water, okay, if that was recent, then oh my goodness, then they need to be treated for amoebic meningitis. So, symptoms swell it because of the swelling of the meninges. You get the painful headache, stiff neck, and all those other symptoms. Another amoeba is Entamoeba histolytica. This causes amoebic dysentery. You drink the water, and I'm sorry. So you drink the water, you get amoeba. It's a fecal oral route, and it can also cause diarrhea. But also, this is known as a sexually transmitted infection and sexually transmitted infectious disease. And as you can see in the penis and the penile and the around the scrotum, there is a very bad infection. And again, this is because of an amoeba. This one you do not need to know, but some people get pink eye, not due to bacteria or viruses, but their conjunctiva inflames that gives them pink eye. And what they have is an amoeba. Now, we never used to see amoebic pink eye very often, but now, thanks to contacts and people not using their contacts properly, like leaving them in too long, going swimming with contacts, they form a wonderful little place for amoeba to live. So understand acanthamoeba are normally free living, but if there's an opportunity, they're in a lot of fresh water, they'll get under the contact lens and they will have a heyday. When we do see amoebic pink eye, 85% of the people with amoebic pink eye are contact wearers. Okay. Okay, so this guy has flagella. He's a protozoan with flagella, and his name is Giardia lamblia, and he causes giardiasis, commonly known as beaver fever. That's a real thing. So let's say you're up hiking and you drink out of that fresh, crystal clear water, and the next thing you know, you have projectile diarrhea. Okay, the doctor says, oh, you have giardiasis. This is a fecal oral transmitted organism. These organisms form very resistant cysts, so resistant in fact that, okay, chlorine in your water is not going to work. So if this gets into your well, like with my cousin, it's gonna be just fine. You drink the spores and there you go. Usually now it's called beaver fever because this can run through the digestive tracts of animals. And while they're up drinking water from that crystal clear lake or stream, they defecate and out come the spores. So, or excuse me, the cysts, I'm sorry, that they form. And again, you drink the cysts. And then it hatches into this guy here. Symptoms: explosive, foamy, foul diarrhea. You might think it might be C. diff, but it's a different smell. This again shows here you have water contaminated with the cyst. You drink it, it gets triggered as it goes through the small intestine, and it sort of hatches out into these guys. The inflammation is very strong. Oh, sorry, here's the little guy, beaver. And again, he can be defecating into the water you're drinking, as well as all the other animals that also like that water. This is what it looks like in a fecal sample, and you can see the flagella moving, and he has a bit of a membrane. He actually holds on to. He has a like a ventral area that works like a suction cup, and it will attach to the lining of your small intestine. And again, causing some, there's toxins that are released, and you're going to have a big inflammatory response that gives you that diarrhea. Again, I don't have a human picture, nor do you want one, but poor baby has giardiasis. Okay. Another protozoan, this one is Toxoplasma gondii, causes toxoplasmosis. This is a beautiful image of this nasty little parasite. It is, again, a single cell eukaryote. It has a double nucleus in it. Kind of interesting. These guys do not have flagella or anything like that, but they are spread very easily all the same. One of the things that you should know is this is actually between a relationship between cats and rodents. Once this parasite gets into the rodent, it will form cysts in the part of the rodent brain that modifies its behavior and makes it sort of wild. It's the same part of the brain that's hit by alcohol. And instead of being afraid of cats and repelled by the smell of cat urine, it is actually attracted to cats. And it will flaunt itself in front of the cat, and the cat will do the cat thing and eat the rodent. And then the parasite gets to go into the cat digestive tract. And this is where it's supposed to then come out and be eaten by another rodent. And it's a cycle that's supposed to be between these two. Unfortunately, humans get involved when humans clean out the litter box, or when humans come in contact with these types of organisms and they don't wash their hands and they prepare food and the food is not cooked. So like raw pork, lamb, and chicken are actually probably these days the biggest culprit. So let's say she goes off and cooks some raw food. So if you eat steak tartare is very popular amongst the French, and so is toxoplasmosis, just so you know. They also love their cats. So are you getting the link here? So again, cats eat infected rodents, and a part of the life cycle known as the parasite oocytes, you don't need to know that, are shed in the cat feces, and humans are accidental hosts. So sometimes they get it in contaminated water. And what can happen is this can get into the human and cause cysts around around this form called a tachyzoite. Again, you don't need to know oozoite, or you don't need to know tachyzoite. You don't need to know oocyst or anything like that. The big problem happens when the human is pregnant, because it turns out that these will cross the placenta and will cause congenital birth defects. It'll cause brain damage and a stillbirth. We see about 60 million cases in the US each year, again, mostly due to food cooked improperly. And all you need to do is wash your darn hands after handling anything, cats, okay? Wash your hands before preparing food and then cook the food. Do not eat raw food, you guys, seriously. So again, this is one way to get it. You're cleaning the litter box and you didn't wash your hands very thoroughly. But again, this is the more common method. These are the cysts that can form in you, but it can also form the cyst can form in the brain of the fetus. So this is not something you want. I know. They're so cute, aren't they, those little vicious predators? This is just the tachyzoites kind of coming out. And again, they can be shed in cat feces. And there they are. All right, so now we're going to move to the worm parasites. Another name for worm is a helminth. There are many worms that are completely free living, meaning they're not parasitic at all, but the parasitic ones are the most fun. So worms are eukaryotic animals just like you. So trying to treating for worm parasites can be a little tricky unless they're staying inside the gut. And like I said, you can design anti-helminths, anti-helminthics that will only stay in the gut, and then it's not a problem. But if they go systemic, if the worms travel throughout the blood and travel to other organs like this is a beaver liver, and this is actually a liver fluke. So if humans do get liver flukes too, and lung flukes and blood flukes. So this would be very hard to treat. Okay. So the worms really come in two varieties. The parasitic worms, there are the flatworms or platyhelminths, and then there are the roundworms or the nematodes. Okay, flatworms consist of flukes. Okay, sometimes known as trematodes, but flukes. And like I said, there are lung flukes, liver flukes, and blood flukes. Most of these are not common. I will show you the only common type of fluke problem that you might have. Blood flukes, one of the common blood flukes has a name of schistosoma, and there are many kinds, but if you get a blood fluke, it tends to be called schistosomiasis. Okay. And like I said, we'll also talk about flatworm tapeworms, and I'm just going to talk about beef tapeworms, but there are also pig tapeworms that humans get. Roundworms, I'm going to talk about pinworms, are the most common. Okay. All right, so here we have a type of schistosomiasis. Remember, I said schistosomiasis is a blood fluke. We don't usually get these in humans, that as far as the ones that actually infect the blood, but ducks do. And if you're wondering, okay, what do I care about that? Well, okay, so the ducks will have a form of blood flukes. Again, these are parasitic worms, and the ducks will poop in their water, you know, rivers, lakes. Ever seen a river or lake with wild ducks? Well, then probably there are blood flukes swimming around, but okay. So this form, the eggs hatch, and then you kind of get an intermediate form that enters a type of snail, and then it bursts out of the snail and forms this form like this. They have a little forked tail, and their job is to get into another duck. So parasites tend to be pretty specific. If they get lost, sometimes they get into a human. So they're looking for something like a duck, splashing around, okay, kind of warm-blooded. And okay, they're heading towards the duck, but oh, there are humans here. And so then they take a left turn and they try to get into the human and they get stuck. And it's not going to cause a blood schistosomiasis, no, 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 but it will cause something called swimmer's itch or duck itch. Okay? So, like I said, the little worm intermediate form gets confused. It gets stuck in the skin, so it doesn't get past your first line of defense. It will cause an inflammatory response. And again, this is called duck or swimmer's itch. So here we go. So what do we do to prevent this? So when you're done splashing around in a river or lake, okay, and chances are there's wild birds, wild ducks, go shower and towel off vigorously. Here are the little fork tail little worms. Okay, these guys. Okay, this is them using electron microscope, but they're stuck in the keratin layers of the tissue here. But you still have an inflammatory response, so you get duck itch or swimmer's itch. But again, it won't get farther than this. It's an irritant. Okay, just towel off, shower and towel off. Okay. Let's now talk about another flatworm. These are tapeworms. So called because it looks like little tape, like little bits of tape measuring sections, right? So there's a couple of parts. There's the head region, the scolex, and once this passes through the digestive tract, the intermediate, the head region or scolex attaches to the small intestine. Ugh. Holds on there. Why the small intestine? Because that's where the best food is. Now, from the head region grows the body region, these little segments called proglottids. Okay, each segment is a proglottid. The proglottids have both male and female structures, just FYI, and they break off on purpose. So sometimes you see bits and pieces of tapeworm material in feces, and you think the whole worm is gone. Oh no. The head is still burrowed into the intestines of the animal. The worm actually, once these are almost like perforated, they will break off, and these are meant to break off to infect the next host. Okay? Okay, so now I'm going to talk about the beef or pig tapeworm. They're pretty much the same. Tapeworms are flatworms. Again, we're still talking about helminths, flatworms. You don't need to know the word Tania saginata, but this is the most common beef tapeworm. Okay, so that's this part is FYI, but the following you need to understand. So what happens is the worm passes through the digestive tract of the cow or the pig. So the little sections, the proglottids, and here they are, they break off, they're in the feces, and there's a little muscle in there, and they crawl off to grasses to be eaten, hopefully by the next cow. And once eaten again, it passes through the cow or the pig. Now, some of the worms will migrate out of the stomach and insist into the muscle of the cow or the pig. So this is called measly meat. In the cow, it's measly beef. Okay, so the worm will get there. Now, how does so this is kind of a cycle that happens between the cow and the pig. Now, how does this get into a human, you ask? Well, there are two methods. The most common is you eat pork or beef that has the tapeworm cyst in there, and you eat it and you become infected. Okay, humans eat the meat, and the scolex attaches to the small intestine. The proglottids grow out from the small intestine, and there you go. So, in some individuals, they never know that they have a tapeworm. They might notice bits of the tapeworm coming out in the feces. This can cause weakness, weight loss, and bowel obstruction. Usually, this occurs if the patient themselves are rather weak or they have a big lot of parasites in there. They will maybe experience this. Okay. So this is probably if you're going to get a tapeworm, you want it this way. There is another way to get a tapeworm, and that is if the human eats the proglottids that are in the grass instead of the pigs and cows, and they eat it directly. Well, then instead of traveling out of the gut of the cow or pig, it'll travel out of the gut of the human and form cysts there. So this is actually measly beef. I just wanted to show this. Oh, sorry. And so these can form cysts in the human tissue. If it forms in the brain, this is bad. Okay. But I wanted to show you if you ever see something like this in beef or pork, this is measly beef or pork, and this would not pass FDA approval. I know this is gross, and let me tell you, if you ever desire to be a vegetarian, one of the things you could do, may I suggest, is take a parasitology class, like I did. It didn't work, even with Dr. Luntz saying you can eat your parasites, just cook them thoroughly. So cook them thoroughly. Also, wash your hands before you ingest anything, because if you are ingesting little peats of tapeworm, you might get a cyst somewhere. So, especially important in pregnant people. Little side note, people used to eat tapeworms to get skinny. That doesn't work. The form of the tapeworm that you would digest is not the one. Okay, that is not. You have to eat the raw pork or beef in order to get the tapeworm in the gut, right? And so they would give people the wrong kind of tapeworm type, and it would not make you skinny. And even if it could, it would make you sick. I mean, even if it could, it's disgusting. All right. So let's talk about a roundworm now. Another helminth. This isn't a flatworm. This is a roundworm. So not a platyhelminth. By the way, one way to remember platyhelminth, flat like a plate. Okay. Nematode. Nematodes are roundworms, and again, a lot of them are free living. Our farmers are always, I think, killing them. I always see the commercials, hear the commercials about killing nematodes in the soil. But a lot of these are free living, but the parasitic ones are the most fun. Ways to get parasitic nematodes. Usually you can either eat the larval form or the egg. Okay. I could go on about this, but I'm going to talk about the most common form of the most common nematode parasitic worm is Enterobius vermicularis, now commonly known as the pinworm. Turns out a former student of mine is battling this right now. Daycare centers throughout the world are trying to get through this. So if you have to get a parasitic worm, this one's the best. They don't latch on to anything. They stay in the digestive tract. So treatment is not as toxic, and that's a good thing. You just design drugs that stay in the intestines, okay, in the digestive tract. So what happens is you have male and female worms, and they're frolicking in the intestines. And then at night, every night, the female then travels down to the anus where she lays her eggs. And so one of the things, and so the eggs come out in feces, or also just it's easy to come in contact with the eggs. The eggs can be on clothing, on bedding, on your fingers, on food. Okay. People who have this have a very itchy behind, and sometimes they don't wash very well. And they can have this under the cuticles, under the nails, that sort of thing. Okay. In little children, this is really common. And, they're not really good at washing their hands. So they scratch their behind, and they don't wash their hands, and they go share a cookie with the, sibling, or they play with toys. And, if the other children around them put everything in their mouths, and they're going to get eggs. And yeah, you can keep treating this infection, but little kids are always reinfecting themselves. So you can treat the adult worm, but the eggs are still going to be at the anus. And if the kids scratch and then put their hands in their mouths, they reinfect themselves with eggs over and over and over again. So once this gets into a family, it's kind of hard to treat. So you have to teach the kids to wash their hands thoroughly. Bed clothing and all clothing need to be washed very vigorously. Hot water. It's a problem. So how do you know if you have it, or the or if children have it? Again, usually a scratchy little rear end. Another way to do this is so scratchy rear end. But at night you can get some tape, some clear cellophane tape, and sneak into the kids' room and pull the breeches down and put a little piece of tape up against the anus, and the female worms and the eggs will probably come with, and you can take it to the doctor. Although I'll tell you what, if pinworms are going around, the doctor may not even bother. They might just give the child an antihelmintic, So a drug that works on worms, right? So they're eukaryotic, you are eukaryotic. So something antibacterial, antiviral won't work. You have to use something that kills them. And remember, it's probably something that's going to paralyze them, paralyze the little worms. And if it stays in the digestive tract, then it won't be a problem. Okay. So yeah, this is the adult female worm, by the way. So again, you don't see the males at the anus, just the females, but the adults are frolicking in the intestines, as you can see here. Females are bigger than males. So this is a horrifying picture, I know, but I have a point to this. So I wanted to point out that if you have intestinal worms that stay in the intestines, you can design a drug that also stays in the intestines with the worm, doesn't leave the intestines, doesn't go through the circulatory system, around the liver and the kidneys and all of that. So it is safer to try to kill a parasitic animal, okay, if it stays in the intestines. So that's a little better. But what about worms that travel throughout the body and go systemic? And in this particular case, now this is a dog heartworm. Dog and cats get heartworm. When a mosquito bites them, they inject the larval stage, and that travels through the bloodstream. And eventually, the larval stage develops into the adult stage here in the heart. And you can see it is wrapped through the many chambers of the heart. So how are you going to poison these eukaryotic animals, meaning the worms, without poisoning the dog or the cat? So, and the veterinarian has to be very careful about treatment. Treatment is over very long periods of time, and liver enzymes need to be checked. Okay? So if you have to get a parasite, maybe one that stays in the intestines like a pinworm isn't so bad. Okay? Okay. Who is Smiley here? What is this guy? Well, this guy is a hookworm. He is systemic. And again, worms that go systemic are much more dangerous to treat. And yeah, you're probably going to get some systemic symptoms as you get inflammatory responses everywhere that he goes. Okay? Or this could happen. So there are two species of hookworm, Ancyclostoma duodenale. You're going to find these in India, China, Japan, and the Mediterranean area. If you're looking in Africa and also Asia and the Americas, yeah, you could see Nicator americanus. And of course, your assignment, if you haven't done it yet, includes this little guy. So there's that little podcast on hookworms. This is it. Okay, so there are two ways to get a hookworm. You can ingest the eggs or come in contact with the larva. For example, if you are walking barefoot, particularly around a place where there's fecal matter. So, symptoms. Well, it depends on how the little creature entered the body. But if you were walking and you stepped in an area close to where the little adults are at, where the larval stages are at, they will penetrate and you will get an itchy, raised little rash, an inflammatory response where they penetrate through the skin. Now, the larva can travel throughout the body because eventually they are trying to get into the intestines. So one of their ways of getting there is to get into the lungs. Once they get there, that can cause, an inflammatory disease in the lungs. You can get fever, coughing, and wheezing. What you do is you cough it up and swallow, and then it goes down the digestive tract, and eventually you can get adult worms, and they will attach to, basically your intestines, and that can cause pain in the upper abdomen. Okay, so here is a picture. Here are the little worms attached, and this can cause anemia. See your assignment this week. Yeah, because when you have little worms attached to your intestines, you're going to have bleeding, and they're having a great time. You will not. And if they're spreading this way, let's say they entered through the foot, you could very easily have widespread tissue swelling. One of the things to be aware of is that you can these are common in puppies and kittens, which is one of the reasons why you don't want strange dogs, or puppies and kittens in your yard pooping. You don't want them giving their worms to your own family pet. So, Okay, ready for some questions. Of course, that's why this lecture always runs a little long. We have our questions and answers, right? So, Enterobius vermicularis, what are we talking about here? Pinworms, beaver fever, meningitis, sexually transmitted, flu-like symptoms. What is related to Enterobius vermicularis? A, pinworms. Very good. Yes, pinworms. That's Enterobius. So is this a systemic flatworm, a nematode that remains in the gut, or these viruses that remain latent in a neuron? Enterobius vermicularis is a nematode that stays in the gut, right? In the intestines. Okay, how is Toxoplasma gondii transmitted? Now, this is tricky. Okay, so be careful. Infected copepods, infected mosquitoes, raw beef, infected cat feces, infected fleas. You said D, infected cat feces? Okay, or did you say C, raw beef? Hopefully you have both. C and D are correct. Oh, see, I said tricky. Told you. All right. What's another name for tapeworm? Flatworm, nematode, protozoans, apicomplexan. Flatworm. Yes, they are. Flat like a tape measure. Oops. Yeah, sorry. Okay, so what is this whole structure called? Oh gosh, we have hooks, we have sucker discs. So this is a proglottid, a scolex, schizogony, diatom, or trophozoite. Okay, hopefully you're only recognizing a couple words. This is a scolex. Okay, all right. What is the name of the disease caused by Naegleria fowleri? Algae dysentery, dog heartworm, amoebic meningitis, red tide farmer's lung. Of course, this is an amoeba, amoebic meningitis. Good. Okay. What would put you at risk for contracting a beef tapeworm? Walking barefoot in Africa, inhaling worm larvae, getting a cut on the skin, eating infected crayfish, eating larvae in measly meat. Ah, you got that one right. Yes. E, eating larvae in measly meat. So that's one way of getting beef tapeworm. And there is another way too. Okay, which of the following organisms is transmitted by mosquitoes? Is it A, Trichinella spiralis, B, Enterobius vermicularis, C, influenza, D, Zika, E, Lyme disease? Ah, did you get that? Okay, Zika, of course. D, Lyme is a tick. Okay, so Zika, D. All right. What is a relatively common complication associated with Lyme disease? Is it neurodegenerative disease, sterility, vomiting and diarrhea, pulmonary lung disease, diffuse rash with a high fever? Well, it has a rash, but it's a bullseye rash, doesn't it? So, neurodegenerative disease, A is correct. Evil Lyme disease. Which of the following is an example of a vector? Is it a tick carrying the bacterium that causes Lyme disease, the virus that causes equine encephalitis, a protozoan living inside a human red blood cell, the larval form of a worm, the resistant form of a protozoan? Well, of course, that's the tick. The tick is carrying a infectious disease causing organism, so the tick is a vector. Okay? What would put you at risk for contracting giardiasis? A, drinking lake water full of infected copepods. B, walking barefoot in Central America. C, drinking lake water full of cysts. D, eating contaminated beef. E, inhaling dust by riverbanks. Of course, it's drinking lake water that's full of Giardia lamblia cysts. Yeah, that would do it. What is a common method of contracting hookworm? Okay, A, drinking lake water full of infected copepods. It's pretty much the same thing. Walking barefoot in Central America, drinking lake water full of cysts, eating contaminated beef, inhaling dust by riverbeds. Of course, it's walking barefoot in Central America. Okay? Central America more than the rest of the Americas. But you can get this here. It is possible. Not common, but you have to go south. But yeah, okay. Now, let's talk about sexually transmitted infections, STIs, and sexually transmitted infectious diseases, STDs, or actually STIDs. That's another name for it. This is mercury, toxic mercury. You don't even want to touch this stuff, right? Well, it turns out this is what they used to use to treat some sexually transmitted infectious diseases. Yeah, ugh. Okay, so yeah, we don't use mercury to cure these diseases anymore. Yay. So a little bit of a background. This is from the CDC 2017. So sexually transmitted infections, sexually transmitted infectious diseases are still pretty common out there. You do not need to know any statistics for the exam, but for just for life and just a baseline of knowledge so you can talk to people about this. You need to know that it's still out there. We see 20 million new cases of gonorrhea, chlamydia, and syphilis every year in the United States, and those are only the reported cases. Okay? So, and there's a lot of people who are carriers and asymptomatic. And if you don't think that's a little scary, okay, I don't know what could scare you. Maybe a quiet place. I saw that over the weekend. It was, yeah, scary, startling anyway. About one half are individuals between the ages of 15 to 24. You ladies have kids. Yeah, scary. Okay, so this just shows young people account for a substantial proportion of new sexually transmitted infections. So the purple ones are the 15 to 24, and then this is for the adults, which is probably where you fall into, or you're really close. This is certainly where I fall into. But yeah. So what are the consequences to this for public health or just individual health? Well, sexually transmitted infectious diseases can cause miscarriages, stillbirths, blindness, mother to infant disease transmission, ectopic pregnancy, which means that a fertilized embryo is unable to implant in the uterus and develops or tries to develop outside of the uterus. Infertility and cancer is, of course, the big C. So all of these quite awful, which is why we have to be able to talk to one another about sexually transmitted infectious diseases, and we have to talk to the young people. We just do. We have to talk to the kids. We can't be embarrassed. It's just there's too many consequences. These young boys and girls, they want to grow old. They want to have babies one day, okay? And they want to have healthy babies. So we need to talk to them. This is just showing how the rates are as far as this is from the CDC starting from 1985 to 2015. So you can see that gonorrhea was really high at this stage, and it has gone down, but it still has sort of some cycles going through it. Thank goodness syphilis is staying kind of down there. Hurrah. I did want to point, can you see that gonorrhea is kind of starting to creep back up again? And look at chlamydia. Yeah. Okay, so let's begin by talking about syphilis. This is a big one. This has been around for so long and is there's so much that I could talk about this historically. There's just not enough time. And there's a lot to talk about it medically, and there's just not enough time. But syphilis is caused by a bacterium known as Treponema pallidum. Here it is. It's a little corkscrew bacterial organism. It's bacterial, okay? Transmission is, well, what happens is a lesion, a skin lesion that will be full of bacteria, comes in contact with mucus. So and this is going to be true for all of these pretty much, but and through any kind of intercourse that involves a mucous membrane. So we're talking about the oral, vaginal, penile, anal regions. All of these are at risk. Okay, so the primary, there's three, actually even four stages of syphilis. I'm just going to talk about three major stages. And the primary stage produces a very unusual lesion. And this is a kicker. So you get these horrible, like, skin lesions, but they are painless. Okay, that is the key. They are painless lesions. And these are called chancres. It's easier to diagnose in males, not as often seen in females. Well, and these could appear in the vaginal area. So, how are you going to see that as opposed to around the male genitalia? There's also secondary and tertiary stages. The secondary syphilis will put a rash on the palms of your hands and the soles of your feet. And you can have lesions appearing in other places, and they are all infectious. Again, all of these lesions will have these little bacteria in them, and they are infectious, and they're good at getting in and causing disease. There's also tertiary stages, tertiary stage. If it goes too far, it can get into all the tissue and causes so much damage, and it gets to the point where once the damage is done, okay, an antibiotic isn't going to help you fix the damage. So you have to get it early in all of these stages. By late tertiary, it's too late. The damage is done. So, which is of course tragic. Gonorrhea and chlamydia, I've included these together because they do travel together. When they test for one, they test for the other. And they have similar symptoms, actually, and transmission pretty much the same way. So, symptoms in men. Okay, not about 95% of infected males will develop some kind of urethral discharge. It's kind of pussy, and it's a good indicator for treatment. So hopefully men will go and be seen, but of course they get embarrassed and they don't. And that's not good. We want the men to get an antibiotic. Go in, get your antibiotic. You're good to go. Okay. So this is the urethral discharge that you would typically see. So with this, usually there's frequent painful urination, swollen epididymis. So as you can see there, and again, the bacteria can cause an inflammatory response both in the urethra and epididymis. I can say that. I, I've known that word for a while. Symptoms in women, unfortunately, women tend to be more asymptomatic than men, I should just mention once again. So, a lot of times, women don't know that they've been exposed and infected until their male partner, is seen, diagnosed, and then they got to come back and let the women know. So, many times, women have been infected and they don't even get symptoms, so they do not know. And this is bad, okay? So places that that gonorrhea and chlamydia will infect, well, the endocervix. So you've got the cervical area, right? They will also get to the fallopian tubes. 15% of those cases result in sterility. You do not want this infected, right? You're going to get scar tissue. You're not going to get fertilized eggs to implant if you've got big scar tissue here. So this is not good. Interestingly enough, these bacteria can hitch a ride in white blood cells, as well as even hold on and grab onto gonorrhea, or well, excuse me, they will grab onto sperm cells, interestingly enough. They will also infect the urethra, the anus, the pharynx. So again, sometimes women will have just acute, uncomplicated infections, and let's hope that's what you get, and that's only what you get. But the sad thing is, 20 to 30% of women will be infected but not have a symptom. They are asymptomatic. If they do have symptoms, again, they might have frequent urination, discharge. Okay, and this is what you would see at the end of a swab. Okay, fever, unusual menstrual blood, anal rectal discomfort. Okay, maybe even a backache. Okay. This can even get quite complicated and go disseminated. What does that mean? It means go throughout the body, right? And can cause some really serious complications. And this can occur in 2/3 of the really complicated, uh, well, you see, when you see about the complicated cases, 2/3 of these are going to occur in women. All right, which I said earlier, I know. We know that if the woman is menstruating, that this is a bad time to catch a sexually transmitted infectious disease, okay? So, yeah, I mean, there's no time, there's no good time to get a a sexually transmitted infectious disease. But if you have sex during your menstrual period or your menstrual cycle, uh, during menstruation, I can talk. I really can, because of the blood, the loose, the hemoglobin, the iron, the bacteria are going to love this. So the bacteria will actually thrive in that environment. Okay. So symptoms or syndromes, this can cause arthritis. You can get skin lesions. Here we are here. This can get into the heart and cause an inflammatory endocarditis there. It can get into the pharynx, causing pharyngitis. You can get pain throughout all the joints, which is part of the arthritis. Pelvic inflammatory disease, PID. This is when probably the fallopian tubes have become infected. 1 million women are diagnosed with pelvic inflammatory disease each year. And again, if the bacteria are up there, you're going to have inflammation up there. If you have inflammation up there, you're going to probably have collateral damage, scarring, and that can lead to the sterility and ectopic pregnancy. So, which is again why we don't want to wait and see. We don't want to be scared or nervous or embarrassed. If you've got a discharge, go in and get an antibiotic because you do not want this to ever happen. We don't want women to have to suffer through this ever. Actually, and I should mention, it's because of this that when I was in research, I worked with Dr. Gary Gorby at the VA Medical Center, right? And this is the reason he wanted to study gonorrhea. His his adopted mother was she was unable to conceive, and he was so kind-hearted. He thought, okay, we need to figure out some of the reasons behind this. And so this is why he studied gonorrhea, because he wanted to find a way to stop it. Okay, he didn't want infertility problems in women. This is what ectopic pregnancy looks in a pathology sample. So I know, I'm sorry if that was really horrible to see, but you're nurses and you're gonna see more probably. Okay, so one of the things also that I wanted to point out, I know I go on and on about normal microbiota and our normal organisms, but they're so good to us. And normal microbiota can inhibit gonorrhea. Why? Because they will outcompete for the iron. So the good guys, see, lactobacillus, here is a vaginal epithelial cell. They will eat up all the iron. Okay, so this is good. Lactobacillus acidophilus, Staphylococcus epidermidis. They're good at eating iron and out competing the bad bacteria. So they can keep them out. Okay. Okay, another sexually transmitted infectious disease is Trichomonas vaginalis, or trick. It causes trichomoniasis. So again, commonly known as trick. This is not a bacterium. These are eukaryotic like us. They have a true nucleus. And they have flagella, so they are flagellated protozoans, very close to Giardia, actually. This is a very common pathogen. It is very, very, very common. There's about 7 million new cases every year diagnosed in the US. 10 to 25% of women become infected sometime in their life. Okay, so there's 3 of us, ladies. So what are the odds? Okay. 70% are 70% of the carriers are asymptomatic, so you don't know that you even have it. Um, it is sexually transmitted, but I also wanted to point something out to you, that girls can get it from their mothers during, it's called vertical transmission, as the daughter is being born, coming down the birth canal, she can actually acquire trick, which is something that we didn't think happened a long time ago. And young girls would have the discharge, the smelly discharge, and the itchiness, and they would be diagnosed with trick. And okay, we used to think trick was what? A sexually transmitted infectious disease. Can you imagine being a very, very young girl being told that she has a sexually transmitted infectious disease, or being a parent who thinks that their child has a sexually transmitted infectious disease when they do not? And yes, I'm sure terrible things happened. I mean, very, some very not good things because of that. Symptoms, as I said, in women, you get a yellow to cream colored foul smelling vaginal discharge. A lot of itching. Yeah. Men, actually, they tend to be asymptomatic usually, but that means that they could be carriers, right? They might get a burning sensation during urination. Okay. They have to be encouraged to go to be seen. They do. They don't want to. They really don't want to. It's a hard thing, hard thing to convince a male to go do. All right. So some more questions. Yay. What is a relatively common complication of gonorrheal or chlamydial infections? Sterility, coma, dementia, paralysis, encephalitis. Sterility. I know I don't have letters on that one, do I? Who is more likely to get a complication due to a gonorrheal or chlamydial infection? You got it, women. This sometimes sexually transmitted infectious organism is not bacterial and cannot be treated with an antibiotic. Trichomonas, syphilis, gonorrhea, chlamydia. Of course, it's trick, right? Trichomonas is only transmitted by sexual contact? False. I can have that capitalized. Okay. So what is a major early symptom of gonorrhea and chlamydia? Lethargy and nasal discharge, discharge and painful urination, stiff neck, severe headache, bullseye rash, painless skin lesions. Well, the painless skin lesions that was syphilis. So we're going with discharge and painful urination. So that is something for gonorrhea and chlamydia. And of course, who's more likely to have a symptom? The guys. Women are commonly asymptomatic, which is bad. We need to know we have it and we need to be treated right away because we want to have good, healthy babies. Yeah. What is a major symptom of primary syphilis? Vomiting and diarrhea, fever with rash, stiff neck with severe headaches, bullseye rash, chancres. Of course, it is a chancre, painless lesion, the chancre, yeah. Syphilis is caused by, okay, which organism? Chlamydia, trachomatis, chloramphenicol differentians, Helicobacter pylori, Neisseria meningitidis, Treponema pallidum. I made some of those up. Yes, it's Treponema pallidum. That is right. Okay. So, little joke. You really bring out the germaphobe in me. And that's it. Yay. So, Again, everyone, thank you, ladies. Well, not everybody, but sorry. Thank you, ladies. And, if you have any questions or need any help with your research paper, make sure that you let me know. Don't forget to enjoy this week's little podcast assignment. I know it's hard to enjoy things when you have to do it, but it's very interesting, I promise. Don't forget the quiz, and then we're done. So, ladies, it was a pleasure, and I hope you have a nice, restful break. And in the future, if you have any questions, related to microbiology or immunology, shoot me an email. I have students doing this from years and years ago. So, in fact, just today I answered one on chicken pox and shingles. So, please feel free to ask me. I love this stuff. I love teaching, and it's a lifetime commitment. So, just like healthcare is for you. So,